Okay, good morning. I would like to welcome you to the Board of County Commissioners meeting today, Wednesday, September 2nd, 2020. Please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I would like to acknowledge that today is the 75th anniversary of the end of World War II. It is unbelievable that we have 12 veterans in Central Oregon that were at the ceremony this morning honoring what the men and women of America did to help end that war and bring back world peace. And I want to acknowledge my father-in-law, Bud Adair, who was a prisoner of war for 2.5 years and brought back a lot of memories of the silent men and women who served our country so nobly and what they did. So thank you for your service, and thank you for those that continue to serve our country.
Well, yeah, I'd like to say that it's been an honor, an absolute honor, to know in person some World War II veterans in our community. As a young child, I grew up. It was basically in the history books, but being an adult, an elected official, and understanding the veteran population and some of the Veterans Day events we've attended over the years, as I say, knowing these people that have served our country in the World War II is just amazing and an honor. So yeah, thank you very much goes out to everybody involved in the military.
Yes, we're just acknowledging the end of World War II today with the ceremony, and the fact that we have veterans that are living and walking and attending important events in recognition of what they did to save the world.
Yeah, apologize for being late. I appreciate you've made good comments about that. It definitely is an important part of our lifetimes in terms of how what our parents lived through and what we heard about growing up and the world that was reshaped after that. And thank you for all the people that served in a lot of those places. So
we do have a consent agenda.
So 3 items on the consent agenda. I'll move approval.
Is there a second?
Here. I believe so. Let me just refresh my memory here. Yeah, I'll second that.
Further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So, okay, I believe Nathan Garabee may be on the line. I know he just had a few minutes for us today, and he did give us a report. Nathan, good morning.
Hey, good morning, commissioners. I hope this day finds you well, and thank you for the acknowledgement of our veterans. That's touching, and as a grandson of a World War II veteran, certainly some powerful experiences that he shared with me, and we owe all of our veterans such a great debt of gratitude. So thanks for acknowledging them.
Where did your grandfather serve, Nathan?
My grandfather served in the U.S. Army. He was a combat engineer in World War II in the South Pacific and Philippines. He actually received his citizenship after joining the Army, as he was born in Mexico and was able to join the Army and received his citizenship prior to deployment.
Excellent news.
That's great.
Great. Well, so how are we on our inventory?
Yeah, good morning, and thanks for having me. I just wanted to give you a quick update, and I think I'll be joining you each for some further discussions tomorrow if there's further questions. And I also know that Dr. Conway will be on later today and might be able to have some clarifying points, particularly on the ventilators. But where we're at on that, as far as a needs assessment, we're currently sitting at kind of our critical demand items are still N95s and now nitrile gloves. Nitrile gloves have kind of become the new hard to get item. I think a number of people in industries are now utilizing nitrile gloves where they hadn't in the past, and so that's creating worldwide demand. And we're focusing some efforts on trying to locate and assist in procurement for a number of our community partners, particularly our long-term care facilities, our clinics, and first responders. You can still get them. The prices, of course, have gone up, but you really can't get them in much bulk. And so what's happening is entities are ordering them with a significant lag time, and then starting to run out before their limited supplies get shipped to them. So that's kind of that's the challenge du jour right now is nitrile gloves. N95s are still back ordered, at least the medical grade. The hospitals are getting priority, which is excellent, and they are being able to procure them. We're looking at some N95s that we're looking at procuring on a Department of Justice grant you all approved earlier this spring, and we're looking at possibly a December ship time. Which what I've learned through all this is if they give you a date, add a month and double it, because that's about how long it takes. But so I think I sent you the latest update we had. So we're sitting on total combined inventory. So this includes our public safety stash here at the sheriff's office in order to make sure that we're in compliance with the Governor Brown's reopening guidelines. But total, including what we have for immediate EOC distribution to partners, as well as we have set aside some for a shelter kit in the event that we need to support Red Cross with PPE for like a wildland fire evacuation. We're sitting on about 13,765 N95s. Now, most of those are allocated to that public safety cache. However, in a critical situation, we would reallocate as appropriate. So I don't know that you necessarily want me to go over them specifically, but so that's kind of our hot button item. We are, as the summer proceeds, we've set aside some of the N95 masks for other entities, particularly like around smoke. If we have, kind of a long-term smoke event, reminiscent of 2017 with Millie or 2000, I think it was 11 or 12, I can't remember, with Pole Creek. We have set some aside for community distribution for smoke. If those become, those KN95s as face coverings, if those become not needed for smoke, then we'd reallocate those. And we'll be working with health services and the PEIO team to figure out a strategy around probably a second community distribution of leftover face coverings that we can make available probably this fall, I would imagine, in conjunction with flu season and some of the other things going on this fall. So I think at this point I could just answer questions if you have any.
So one question, Nathan, so I got maybe you can give us information about organizations that are working on their own stockpile or cache. So we do have the hospital system and first responder agencies. Has there been any communication about we think we're going to need, or we have a supply being built? Kind of words around that.
Yeah, so, since early on in this event, we've been encouraging, all of the partner entities, whether that's medical, first responder, really any entity that our service providers that provide behavioral health and social services for our community. We've been encouraging them to develop their own supply, and they are doing that. And like I said, we distributed very little over the summer of PPE, and now we're starting to get little trickle-in requests again that maybe that just the supply chain on certain items is a little tenuous. And so we are going to be communicating with them in the very near future, working on a follow-up. I think in May we did that survey request to kind of determine need, and we're going to follow that up again in the next week or so to determine kind of our long-term strategy around need. I would say that we're probably right now as it stands, I'm feeling pretty good, but not knowing what the future will bring, and so we do have some funds available through DOJ and some others that we're going to try to beef up our law enforcement first responder stockpile. And that will also help us in being a little bit more flexible with some of these others that maybe we can reallocate as needed. So I hope that answered your question.
Well, and then a state stockpile is available in a true emergency situation.
Yeah, and we still have access to the state stockpile. I think everybody, like any preparedness effort, you always want to take care of home first and make sure that we don't want to rely on the state. We don't want to rely on the federal government, as we know that's we'll get ourselves in trouble if we do that, and the time and that it takes sometimes to activate those resources are challenging. So we want to build our own resilience here locally, be able to lean on the state if we exhaust our resources, and then on up to the federal government.
And then one more question: is there a burn rate that's very high because of the fire crew activities, and is there own supply through that?
So that's a great question. Burn rate has been pretty moderate.
Referring to the supply burn rate, not the fires out there. Yeah.
Yeah. No, I know where you're going. So the burn rate has been surprising, or I shouldn't say surprisingly, but manageable. And all of those agencies, the state, federal agencies, worked pretty diligently into the spring and early summer to provide their own PPE for their resources and crews. We did on the Green Ridge fire. We did take some PPE and supplies out to them to support their COVID module at that incident management team. And that was mainly around getting them immediate supplies because there's going to be a couple day delay to get it from the state. So, and then we'll work a payback situation. We're working a payback situation from them. So they were pretty fortunate in being able to get, I think, what they needed. I know all the task forces and crews are coming with their own PPE. And then there's each fire has a kind of a backup cache if they need additional.
Good, okay, thank you.
So Nathan, are these supplies still made in China? The N95s? Is that where they're coming from?
I think probably all the N95s we have currently are made in China, with the exception of there's starting to be some 3M products that are made in the United States. And the challenge with that is it sounds like the federal government and a number of states contracted and kind of gobbled up this first several months of supply out of the 3M American-made N95s to kind of fill back up the strategic national stockpile as well as state stockpiles. So we're hopeful that by the end of the year, we'll be able to start getting some of those American-made N95s. And then we're also looking at a couple products. For one is actually made in Medford. It's as of last check, it still hasn't been NIOSH approved yet, but hopeful that they will get NIOSH approval. And so we have a couple of those sample masks we're testing, and it'd be really exciting to be able to procure an Oregon-made product.
In Medford. That's great.
Yeah. Yep.
So I'm a little bit vague, Nathan, on some of this. So the way you call a sheriff's office cache is really public safety cache. So it's for all fire, EMT, and law enforcement within the county. It's a backup for any of those agencies, including our own, the sheriff's office. Is that how you define that group?
Yeah, and that's it's cached at our storage.
Right. So this is the stuff under your control.
Yep, and I mean, I guess technically it's all kind of under our control.
Well, I would bet that every law enforcement agency and fire agency has their own cache. If I was running one of those, I would have my own. Just like we don't want to depend on the state, they probably don't want to depend on the county and whatever. So, has anybody ever kind of verified those numbers? Because that could be 5 times this many. And it's really what I'm always looking at is the big picture of take the borders of our county, what's in our county. And so.
Yeah, we did in May, and we're reassessing that in September. I can tell you that I know for a fact that a number of our law enforcement agencies have reached out to us seeking assistance in getting some N95s out of our stockpiles because they haven't been able to procure them yet. And they're running.
But do you keep a big picture spreadsheet on all that? Because the fact that we have 27,000 nitro gloves, what I really want to know is what's in the county. And so is there 270, 2,700, 27,000 out there besides ours? Because what's really not a slice of the pie doesn't tell us the whole thing. And that's, I guess, this looks like a slice to me.
No, I think you're partially correct, well, you are correct. I think this spreadsheet doesn't account for that. We did that in May to determine, and I don't have that right in front of me. I wasn't prepared to necessarily speak on that. I apologize. But we are going, like I mentioned, we will be in the next week or so reassessing everybody's current state of supply. The challenge with that is, we don't have any additional staff to manage all that. So we're kind of doing this in addition to all of our other duties.
Well, we could give you additional staff, I believe, and we'll have to see if the other commissioners supported that. But I would think that'd be something you just would ask and say, I need somebody to make calls to 25 agencies to get this spreadsheet filled. I don't see this as something you have to do, but I think it's something we should do as a county to really, because it's all kind of irrelevant. We don't know who has what, and that's like the state having what they want, 110 million for
105 million.
105 million for PPE. We have no idea, where it is, who gets it, how it's gotten. I mean, maybe you do, but I mean, it's a big number, but it's kind of irrelevant. I mean,
If you're saying you can't get it till December, where are they going to bump us even back to next year? Yes. What kind of priorities do they have?
so anyway, okay. Well, could we
yeah.
get help to you? Do you think to help with this?
Well, I'm glad you mentioned that. That's actually one of the positions I believe in the CARES funding ask. We recently picked up a temporary employee in the last week or two, and that's going to be one of the projects we're going to have him work on is exactly that.
Oh, great. Okay.
Working with health services. So I'm glad you mentioned that. So that is one of those line items in the CARES funding is the the personnel assistance for PPE, and then we're going to split that time with testing support. So
Now, the other big group that I always wonder about is how much is stockpiled at the medical providers, and they're in the same search that you are, and I don't know if they'll reveal it, but again, the point is that we shut down a lot of things because they didn't have enough surge capacity. And it's one thing for them to say, okay, we've got it now, but it wouldn't be wrong to ask all of them and say, and from a county perspective, it'd be good to know the different components is all I'm saying. So I would support that. I don't know, would you support that?
I do. Yes.
And it sounds like, they're basically working down that path. So we're offering more resources and, this part-time person is there. So
We support that as
absolutely. So, being able to see results of the effort that's coming in a week or two, it sounds like.
Yeah.
Well, it's fascinating, Nathan, because a year ago, September, is when the Chinese first started buying and sucking up all the PP&E of the world. So it's been a year, and you're telling us that we still are
Buying from them.
we're still buying from them, and we really, we could have more right now, just to be safe.
The other thought about, with regard to where you get your supply, have you reached out to any of the federal, congressional or Senate officials about using their help to get additional supplies here? Because I know that the president's certainly talked a lot about the amount of supplies. I think one of the maybe it's General Motors or Ford was producing a huge volume of masks. And those are things we could put in requests to our elected officials because they like to help also, and that may be an avenue.
That's a great point. I think probably we should wait to reach out to them until we kind of have I think we'll do the snapshot first. But yes, I think that would be a good thing to consider. And then also, we go through the state, so we work with DAS and a number of state agencies on procurement. But I think the issue is I think you're kind of going down a path, and forgive me if I am going somewhere where you didn't intend, but there is a risk that when this is all said and done, you're going to have a ton of agencies with a whole bunch of extra PPE. Now that presents a challenge of, did we misappropriate that PPE from people that really needed it just to hoard it? And we don't want to be in that situation either. On the flip side of that that happened to us.
On that thought, how can you decide whether you're misappropriating from somebody else? I mean, I just think that's kind of crazy. I mean, our job is to get enough for us if there was a second wave or a surge or whatever. The world will sort out whether it's misappropriated. Now, if you're saying we're spending too much money, I guess that's a concern, but lack of preparedness is a concern too. So I guess that's what I don't think we should be trying to decide whether it's fair to the world. It should be fair to us, in my opinion.
No, and you're right. I think we'll know that history will tell us probably that, but no, I appreciate that. And we'll, that's our number one concern, is to make sure that the residents of Deschutes County and our first responders and our providers have adequate PPE.
What about the citizens? I mean, I always hear about the first responders and the providers, but what about the 200,000 people that live here and their access to supplies, or businesses?
Well, I think
businesses that need it, or.
Yeah, and I think it kind of depends on the business. So if you're a business that requires medical grade PPE, we're trying to work with you to support that, or a number of other entities, whether it's Oregon Dental Association or Association of Veterinarians and things like that. But as far as the other businesses, most of the PPE that they're requiring is non-medical grade. The one challenge we're running into is like with the nitrile gloves. I think a lot of businesses are now using nitrile gloves that didn't used to. And so that might be part of the supply chain issue.
Are those made in China also?
I don't have an answer to that. Sorry.
Okay, well, I noticed that a lot of people are wearing gloves, but of course, if you're going to wear gloves, you have to change them quite a few times a day, or so they're really not serving a purpose if you aren't changing them.
That's a great point. And with the shortage of nitrile gloves, I would argue that probably just really good hand washing in most cases is probably a better alternative.
Yes, that's what Dr. Conway had said originally. I did try and wear gloves one day, and I think I changed my gloves like 20 times. And I realized at that point in time that really good soap and warm water is the better way. So, yes.
Perfect. Well, we'll have some information with you, hopefully within the next couple of weeks, regarding that further research we're working on the kind of the county snapshot.
Okay, great, Dave. And so maybe like in 2 weeks, we can bring you back on the agenda then? Something like that?
Yeah, or I can maybe just even provide you with, like I did the other day, I can just provide you a report. Whichever you prefer.
Okay, that would be excellent. Thank you so much.
Okay.
Thanks,
Thank
Nathan,
you.
for being there. I'm glad you've got some temporary help.
Yes, yeah, I am too.
I know, making life a little easier.
Yes, thanks.
Okay, I believe we're ready for our COVID update. Is Nahad available? There.
Good morning.
Good morning, Nahad.
Oh, great. Wonderful. Thank you for inviting us. For the record, my name is Nahad Sadr Azudi. I'm the Director of Public Health for Deschutes County Health Services. And I have with me Dr. Richard Fawcett, our health officer. And Dr. Conway, I believe, is also on Zoom. And yes. Okay. And this is the weekly COVID-19 public health update. Also, I'd like to acknowledge and thank Jenny Faith for the great usual work that she does in preparing the data.
Thank you, Jenny.
Last week, commissioners, we had the inaugural launching of the community quiz. And congrats to the two winners.
Nuhad, Dr. Conway, we've got we need one person on?
Yeah. I
Okay,
think it's on mute now. Sorry.
thank you.
Yeah, and so congrats to the two committee winners. Just a reminder that if you're watching this presentation on Facebook, please insert the answer in the comment section. And I believe that the first 5 community members with the correct answer will receive a beautiful fanny pack, which can be used for carrying our masks and hygiene.
Is this being broadcast live at this time, Facebook Live? Just
Yes, I
confirming
believe
in the back.
Stephanie, we are being broadcast on Facebook, correct?
Okay.
Okay.
I'm thinking okay, it's up there, yep.
Okay, we're good now. Thank you.
We're good now?
I believe so.
Okay. So in case, maybe I should just repeat in summary quickly that if you're kindly watching, if you're taking time to watch this presentation, first of all, we appreciate it. And second of all, if you would please put the correct answer to this question in the comments section of Facebook, the first 5 community members with the correct answer will receive a beautiful fanny pack, courtesy of the county and the commissioners. So this week's question, which is a follow-up to last week's presentation, is around population immunity. And the question is, population immunity is a function of A, vaccination coverage and vaccine effectiveness, B, blood type and vaccine efficacy, C, vaccine dose and immunogenicity, and D, basic reproduction number and herd immunity. So only one answer is correct, again, in the context of vaccination that I presented last week. So I would appreciate if you put the correct answer in the comments section, and you will benefit from this beautiful fanny pack. Commissioners, if you allow me, in light of the upcoming Labor Day holiday, I have 2 quick true stories to share. The first story is called The Miracle. Most of us wake up in the morning, we open the water tap and drink a glass of water, trusting that it's safe. We then prepare and eat our breakfast, trusting the nutrition label on the ingredients. Some of us then get on our bikes, put on our helmets, and use the vast bike lanes in our county to get to work. Others of us get in our cars and put on our seatbelts and drive safely to work. At work, we don't worry about asbestos or lead in the wall paints. We finish our work, and on our way home, we decide to stop by a nearby pharmacy and get our flu shot. Then in the evening, we decide to eat out at a neighborhood restaurant. We enjoy our meal, and we don't think twice about the safety of our meal. In some miraculous way, we go through our days without worrying about the basics of our health and safety. But we know that there are 300 plus staff at health services who are behind those daily miracles. There are tens and hundreds of colleagues in other county departments and the commissioner's office who are also behind those miracles. So this is to say thank you to all those unsung heroes working behind the scenes without much recognition, who make our lives worth living. And now onto the second quick true story, and I call it The Liberty. And it starts with one of my favorite quotes by Patrick Henry, one of the founding fathers of our great nation, who said, "Give me liberty or give me death." I love this quote because it captures who we are as Americans. I also like it because the word liberty inherently posits individual choice for oneself. Now, we all know that holidays are a great time of get-together, celebration, and opportunities for creating memories. In the context of COVID, holidays are also defining moments because our individual choices and behaviors will dictate how quickly the COVID virus spreads in our communities. And what our investigators and contact tracers tell us, commissioners, is that social gatherings are a major category of transmission. So I would like to share a quick story from Central Oregon about a large family with 3 confirmed cases, which exposed at least 5 other families through a social gathering. One family lives in another county, and one of the household members works with an elderly woman who became positive and exposed several other women who also became sick and tested positive. In total, there were 17 associated COVID-19 cases who isolated for 10 days or more, and 18 additional contacts who quarantined for 14 days. The outbreak occurred over a 1.5-month period, and 2 people were hospitalized. So liberty posits individual choices, but more importantly, it's about smart choices. And speaking of smart choices, this slide shows the county cases by week. As of yesterday evening, we have a total of 693 cases and 11 deaths.
Nahad, could we go back to that story, the tale? When you're saying a large family with 3 confirmed cases, you're saying that those people knew they had COVID and they were at a gathering? Is that what your story is?
No, Commissioner, the story is about basically, we don't often know if we have COVID, right? The asymptomatic cases, we could be 40, 50% of the proportion of positive cases. We show up at social gatherings, at birthday parties, at other events, and without knowing. I'm hoping that those who know don't show up, but most of us don't know. And we show up, we interact with people, we don't wear our masks, we're in close proximity with others, and we spread the virus. So the story is really around many of us don't show symptoms and we do transmit the virus. And if we're not taking precautionary measures of wearing masks and socially distancing, then we're definitely spreading the virus in a multiplier effect, in fact. Thanks for raising that point, Commissioner.
So Nahad, I want to comment on both of your points. One is, I think all the commissioners, and I certainly do, really appreciate all the efforts by the health department staff. We could go through a list. We probably ought to have an awards event at some point just for their dedication and effort. I mean, it's been almost 6 months now, and it's really been remarkable. We've learned a tremendous amount over 6 months. I appreciate that, and I just want to say that also. I know you say at each meeting, and so I just want you to know it's not lost on me also, and I really appreciate the information they've been giving us, et cetera. But really, it's the help for all the community members. The second is that, one of the questions I asked about a month ago was, tell us some of the stories that you're learning from tracing. What do we know about the spread of COVID, how it spread, et cetera? And this is your story here is exactly kind of what I've come to realize generally, and it was really what I was asking, and I'd like to hear more of these kinds of things as examples of what is being learned from the tracing of how COVID spreads, et cetera. And I think we have all come to that same conclusion that you are at risk when you're in close contact with people, particularly for a long period of time of social interaction close up, and that can be family events, that can be meetings where you're all in a room close up, it can be any of those kinds of things. So I think it's really good you're pointing that out, and it's certainly what I think we try to avoid in any way we can. One of the big ones that I still wonder about is the outside events, outside gatherings where there's a lot of fresh air and the wind's blowing, et cetera. It seems like most of the cases they're inside events where this exchange of air and moisture in the air is passing and it goes on, for long, periods of time. That seems the most at risk. Do you want to comment on any of that kind of beyond just an anecdote? Is that it kind of is what you said last week?
Yeah. Commissioner Henderson, first of all, thank you for acknowledging the staff. And I'd like to highlight that this COVID pandemic has put health services sort of made it more visible. But I would say that 95% of the times, and especially prior to COVID, the work that was done in an invisible way. And that's the success of public health, that we don't think about public health because it's going well. We only think about public health when maybe something is not going so well. So that's, but I appreciate your kind words, and I appreciate Commissioner Dare and Commissioner DeBone as well. They always, all of you always acknowledge the hard work, and public health goes beyond health services, by the way, right? And when I say public health, I'm also including behavioral health. So overall health of our public.
So, but I guess what I'm wondering, Nihat, are you trying to explain this to us, or are we trying to say this to the world that may not know? I mean, we're involved in health all the time, so, and we're very appreciative of what the public health department does and the behavioral health department does.
Absolutely.
And
No, absolutely. Commissioner, this is a platform also to connect with the community and communicate with the community. And this is really an opportunity because of the Labor Day weekend to highlight sort of the what their public health colleagues and staff do for the overall well-being of the community. So this is a opportunity to connect with our community. We know very well how supportive you are, and you show that through not just your words, but also your actions and funds that you provide the health services. So that's, I think, this is mostly to connect with the community.
Okay.
In terms of the stories, Commissioner, we are going to do a better job of gathering some stories around the experiences that we're having and the community is having, and certainly provide more of them during this platform. For sure, we can do more of that. And your point about outdoors, I think it's an important point, and it's something that's being also discussed from the White House, where they, if we listen to the White House task force on COVID, they make it clear that outdoors is better than indoors. Why? Because of the ventilation and the amount of virus gets diluted before being inhaled. So that's certainly an advantage point of being outdoors, but it's not guaranteed. If we're outdoors and next to each other and speaking or singing or coughing, still the amount of virus, depending on the amount of virus that one inhales, it can affect their health. But certainly outdoors is better than indoors. So,
And real quick, one more note on that. Outbreak occurred over 1.5 months, or 1.5 month, 6 weeks. That's the pace of this. That's the interesting thing that, contact tracing, the time of incubation, the time of being sick and recovering, that is very interesting information for the community to understand that there's just a pace to this. And this is looking backwards at something that took 6 weeks to evolve. So that really puts some things in perspective. So I want to thank you for putting that information down on paper also.
Thanks, Commissioner DeBone, for raising that. I was actually just going through quickly through this story, and I appreciate the questions you're raising and dissecting the story, because there's a lot more to this. You're right. I just didn't want to take your time so much. But that's 1.5 months of staff time working over the weekends to follow up with the not just the case or the cases, but also the contacts and so on. So that's a lot of effort, time, energy, money, and weekends lost, and evenings lost with our families. So thank you for raising that.
Thank you.
Okay, may I continue? Great. So this slide, Commissioners, shows, as I mentioned, the county cases by week. And as of yesterday, we have 693 cases and 11 deaths. I believe one more death will be officially announced today or tomorrow, unfortunately. It doesn't get any easier, frankly. And this massive drop that we're seeing is real, and it's, in my view, is as a direct result of our actions and choices we're making in our community. And I believe wholeheartedly that mask usage, increasing use of masks in our daily lives is making a difference. That's not to say that the numbers may not go up and down in coming weeks. Nevertheless, we do know that there is a cause and effect in all this. This is not just suddenly happening randomly. Our choices do make a difference. And I really want to say thank you to our community members for taking this so seriously. Commissioners, this graph is the cumulative numbers, and the main message, as has been in the past, is that we did see an increase in rate of change in terms of transmission in the month of July, and we are seeing a slowdown in the month of August. And the slowdown is indicated by the flatness of the line and the curve. So that's really good news as we're seeing the big picture here. Not much has changed in this slide in terms of case numbers by age group. We are seeing a majority, or let's say more than 50% of the cases amongst the age categories of 20 up to 50. But if we look at the next slide here, we do see a bit of a shift from July to August. We see a 7% increase in 60 and above patients who have tested positive, and we see a slight drop down in under 30, from 36 to 30%. I wouldn't read, personally, it's too early to read too much into this and determine whether there is a behavior change or not. I think we need another month or so of data, and then we need to get the outbreaks from the long-term care facilities basically out of the equation in order to determine if we are seeing a behavior change or not, or the demographic shift in terms of the case numbers. Now, this is my last slide before I give the floor to Dr. Fawcett. This slide shows how cases are linked and categorized. This speaks partly to the point that Commissioner Henderson raised in terms of stories and how cases are linked to one another. What we're seeing here, which is really great, is a continuous drop in cases which don't have linkages. We cannot identify linkages for them, or we call them community acquired, or we call them sporadic cases. And the less of those that we have, the better it is in our ability to be able to contain the virus. Because if we can identify the case and the contacts to that case, then we're able to pull them out of circulation, and they, knowingly or unknowingly, would not be transmitting the virus to others. So the case numbers can go down. But if we cannot identify the link, then it's difficult to pull them out of circulation. So this is a great trend that we're seeing here in terms of the community-acquired numbers or sporadic cases going down. So with that, I will now give the floor to Dr. Fawcett. Let me organize the camera for him.
Nahad, I do have a question about the 6% hospitalized. I didn't really think Deschutes County had that many people in St. Charles this last month.
Yeah, so this is 6% of the cases in August. So we had, I believe, let's say roughly around 150 cases or so in August, 6%, so around 8 to 10 Deschutes County residents were hospitalized. That sounds about right. Okay. If you allow me, I'll give the floor now.
Thank you, Dr. Fawcett, for joining us.
Oh, thank you for inviting me. Can you hear me all right?
Excellent. Yes.
Okay, terrific. Great. So I think we have the next slide. Again, looking at the testing tracking in terms of positive, negative, and total tests per week. And we are definitely heading into a very favorable improving trend. Again, looking at the bar graph, it's a little tricky because the positive cases are at the very bottom and kind of the dark shaded line there at the bottom. But we had, as of Sunday morning, Saturday night, 29th of August, 20 cases for the past 7 days, or that period of time, August 23rd through August 29th. And we haven't been down that low for a couple of...
Quite a while.
Yeah, so that was really terrific. There was even one day, I think, last week, Thursday, Friday, I can't recall, where there was no cases that came in. The next day we had 3 or 4 in the morning, but so that was really kind of a nice surprise to see that kind of improvement. So in terms of looking at the graph again, the lighter shaded bar there, column, is the number of negative tests, and then the total number of tests is printed on top of the bar. So we're still testing well above 1,000 tests per day in Deschutes County.
1,000 a week, you mean?
Excuse me. Right.
I'm listening.
Right, about that. Over 1,000 per week. Thank you. Sorry. A little bit less total tests this past week between the 23rd, 29th of August, 1281. And the test rates, although the data is not all in, so we realize that some of the numbers are not back, but we're really quite far below 2 or 3%, even about 1.5% if we do the math. So that's really encouraging as well. But I think too, just looking at some of the data, that in terms of the numbers of tests done per population, that Deschutes County in the state ranks about, I think, 14th over the past week or two for numbers of tests. So we're still kind of in the middle there in terms of numbers of tests per population. Next slide is looking at hospitalized patients at St. Charles Bend. This, again, is just listing the numbers of patients each day at St. Charles Bend that have a diagnosis of COVID-19. That also has been trending down overall. Some of course, those data points are the same patients every day. I think we have 4 today, so I'm not sure how many data points. It looks like it goes 1, 2, 3, 4, 5, probably. That may be yesterday, 3 cases, and 4 today, something like that. I think 2 of them are in the ICU. That's been fairly stable over the past, say, couple of weeks. So that's encouraging that the trend is down in terms of hospitalizations. But there still are ill patients sick enough to be hospitalized, just to keep that in mind.
And Dr. Fawcett, these are all hospitalizations, not just Deschutes County residents?
Exactly. That's exactly true. Yep. That's everything at the hospital. County residents and non-county residents. They're all patients with COVID-19. Correct. Let's see. Next slide.
So, oh my gosh, we're at 10.
Yeah, we are. So we're right there. So we're at that. There's again 2 large metrics. One being trying to achieve below 5% test positivity rate for 3 weeks in a row, and we've been doing that now well over 3 weeks. I believe
5 weeks.
Yeah. Thank you, Patty. But the other one, of course, is 10 total cases per 100,000 population. So with our population in Deschutes County, approximately 200,000, so that would be 20. That's exactly what we had the past week. It was 20 cases. So that's 10 per 100,000. That's listed there for August 23rd. That's the week of August 23rd through the 29th. So we're at that target. I think they want it to be sustained for 3 weeks, of course.
Of course they do.
Yeah. But again, those 2 metrics are a little bit different. One's, in my opinion, harder to achieve than the other if you're testing a lot like we are in general. So, but we're achieving both as of today, and that's good news. Next slide. I just already talked about the test positivity rate.
Dr. Fawcett, do you know the state's positivity rate today? I know it was trending down also. Is it below 5%?
I think it's around 5%.
It was 5.1, I believe, last week.
Right. I think it's stable, the same or a bit lower, actually. So I'll look at that. But it's not much lower than 5%, as I recall.
Well, that was one of the requirements for opening schools. The state rate had to be 5% or less, and then we had to be at 10, and, with our positivity low. So it sounds like things are coming together.
Yeah, no, I agree with that. I do hope, that if there was a county doing tremendously well, with both those metrics, even better than we are doing, and there are some counties that they would be allowed to perhaps open schools, even if the state case rate was higher. I don't know the politics on that, but I think that's the idea, right? The regional data is important. So.
Well, they're opening K-3 in Crook County, but honestly, 5th graders can't be left home alone either legally, and it's really too bad that they set it up K-3. If they would have set it up K-5, I think that would have helped families a lot more. So for those counties that are able to open their schools.
But I think on our phone call last Friday with Dr. Seidler. He was explaining all this, and I think he said that several counties, I mean, besides Crook, are able to be opened, with because they've been down there for 3 weeks. My concern is, what if we jump back up for a week? Are we going to close everything down? I mean, I just don't see how we can do this metric test, because it's also influenced by the amount of testing possibly. If we test a lot of really healthy people, we'd have a lower positivity rate. If we're just testing the ones that aren't, it's a higher positive. I mean, there's lots of variables that really have to do with who's getting the testing. So, do you have any thoughts about this metric, Dr. Fawcett, in terms of opening and closing schools? And
Right. Well, my impression is, and again, I don't know all the facts, so please bear with me with the ideas that I have. In general, when we've achieved a certain metric, especially with the reopening of the economy, for instance, we've gone to phase 1 and phase 2. The impetus or the data that has to sort of be accrued to go backwards is pretty steep, meaning that that I think there's an effort to not go backwards. And again, I don't know how strict different states have been about that. Obviously, been other states the past couple of months that have had a much worse time with a very rapid increase in cases and hospitalizations. So I guess my point is that I'm hoping that once we move forward, that if we're not meeting that metric, by a couple of cases, or it's 13 or 14 cases per 100,000 population, that we wouldn't quickly shut things down. And on the other hand, it seems to me that what schools are talking about, again, this is just information I have through the grapevine, is that schools really want to understand who's actually getting infected in their school. You're seeing that, of course, in universities and other schools, but we really need the ability to find out quickly who in a classroom is sick. And, if the county has 12 cases per 100,000 population in 1 week, but yet most of the schools and all the schools have very few cases, I mean, to go shut those schools down when the schools are doing well doesn't make a lot of sense to me. So I think those things are being discussed, and any other thoughts you have, Mr. Henderson, on that, I welcome, because I think these are really good discussions.
okay, thanks. Yeah, we'll look into that more.
Yeah, thanks, Nahad. So that's, I guess, all I have really prepared for me. So,
Well, speaking of schools, our favorite topic, which all of you are quite passionate about, school immunization.
Some more than others, Nahad.
Some more than others, exactly. But we definitely have your unwavering support on this, which we really appreciate. It makes our lives and jobs a lot easier. So speaking of schools, it's that time of year where we're reminded to make sure that we catch up with routine vaccines. These are vaccines which prevent vaccine-preventable diseases. And it's really a great opportunity for us to make sure that we don't add more complexity or layers to an already existing situation that's burdensome for many of us, if not the whole community. So we've had measles exposure in the past. We've had pertussis cases in the past. Vaccines are safe. They go through rigorous testing, and really encourage the community and the parents to make sure that their children are with their vaccines. And at the same time, we do have the flu vaccines available in our community at your local pharmacy or local provider, your primary care provider, and other access points in the community. All people over 6 months are eligible to receive the vaccine. Of course, there are some caveats, and it's really important this year that we go beyond the typical 40-45% coverage. If more of us are able to get the vaccine and build a firewall or some sort of a protection against the flu, then we're going to reduce competition for the limited medical resources that we have available in our community, in our region, vis-a-vis the COVID pandemic as well. So really encourage the community to start getting vaccinated against the flu, and vaccines are available. and we can start this week. No problem. I'm going to try to do it this week myself, in fact, and get my kids and spouse also drive them to a local pharmacy and do that.
Excellent, Hod. I would expect nothing less than you to be one of the first to get that vaccination. And I do want to say that as a person who had someone in my immediate family who had polio, vaccinations, they are critical. There are diseases that we can bring back that were basically almost eradicated all over the world with what's happening with our herd immunity becoming smaller, and the unvaccinated group is becoming larger, and it is quite dangerous. So according to what I've been told by public health, children actually need 22 vaccinations, not 72. It is 22. So if your children haven't had their vaccinations this summer when they should have, please seriously consider doing that. And flu shots, I think, are going to be more than ever this year. And hopefully they caught the right flu. So, but oh yeah, please let us know. Take pictures, Nahad. We'll put it on social media when you guys get your vaccination.
Sure, we'll do that. Yeah, Commissioner, I think I said it in the past that this is what life would be like if we didn't have vaccines. This is life would be like every day. The life that we're experiencing during COVID is what life would be like if we didn't have vaccines. We would be worried about some disease out there that we haven't had the protection for. So, so this is an amazing, miraculous technology that is giving us a peace of mind, in fact. So, Commissioner, in terms of our last slides, key messages, we, as I always say, we cannot compromise our values in our county. We need to remain as we are, always continue to be kind. Mistakes are okay. I make mistakes all the time. We should be forgiving. We should do no shaming, and just support one another. We need to understand the 3Ds. This was the question from, in fact, last week. And that's dose, duration, and distance. Dose is really important, and masks play a role in reducing the exposure to the amount of virus that we might inhale. Avoiding the 3 Cs, closed spaces, crowded places, close contact settings, and doing the 3 Ws, wearing masks, watching our distance, and washing our hands. So, Commissioners, kindness times 3D times 3C times 3W. What does it equal?
Deschutes County.
Deschutes United, Deschutes Caring, and Deschutes Smart. And going back to the quiz, so drum roll. I don't know if anyone has, I don't know if Whitney's there, I don't know if anyone has provided their response to this quiz question. Should I give
No, this is Whitney. We haven't had any responses so far.
No? Okay, so then I'm not going to give the answer away in case people in the community wish to watch this presentation later and give a response. We would welcome it, and you would benefit from a fanny pack.
Maybe they liked the prize last week better, Nahad.
They might.
Well, and I might ask that you define the terms a little bit real quick. So some of them, as I say, I could understand, but other ones, immunogenicity, I don't have no idea what that is.
Yeah, that's the point, because Commissioner, I realized our community is quite smart, and they responded really quickly last week to. So I tried to make it a little bit more complicated, but I'll be happy to come back at the next session and break these down a bit more.
Okay.
But I'm sure anyway our community is Googling it.
Okay, that would.
I might Google it by then, anyways. Yeah.
Yes.
Right. So thank you again for inviting us. Really appreciate your time and patience through this. Presentation and the great questions and the acknowledgement for our health services.
Yes, thank you, Health Services. I hope that with the teams you've hired, our health people can at least get 3 days off. And I know they've been working hard for 6 months. So it would be, I'm sure, a welcome break, and don't have a big family gathering. Because
No, and Commissioner, there, I don't know if Dr. Conway had anything to add. I think there's something maybe around fire that he might wish to add.
Okay.
If you...
Yes, Dr. Conway, would you like to join us?
Good morning, Commissioners. So a few things. One is a answer to a question that may or may not have been fully answered about your question about the 6% hospitalized in one of the data slides that was shown. So that's people that were hospitalized at any time during the course of their COVID illness. As far as smoke goes, just maybe three things. One of them is that if I can share, see if I can share my screen here. So this is a picture of basically an outline of a person. And the thing we worry about in wildfire smoke is small particles, PM2.5, and those can cause irritation throughout the breathing tree, as it were, headache, sinuses, throat. And then for people that are susceptible, that have chronic illnesses of COPD, asthma, et cetera, they may be more susceptible. So we encourage those people to stay inside even when there's just visible smoke, and certainly when the air quality index is elevated. And the only other thing is to bear in mind that the masks that have become very common for COVID prevention, which are typically cloth masks or what some people call surgical masks or procedure masks, are very effective at stopping a cough and a sneeze, but they would not afford protection from smoke. So if there are people that want to or need to go out and work or do chores when it's very smoky, and if the AQI is really elevated on the Central Oregon Smoke website or on the Oregon DEQ site, then they should wear a properly fitted N95 mask. And actually, those are the industrial style are typically available in home improvement stores unless we have a real run of smoky weather. That's all.
Thank you.
Okay.
We have other information on our website as well as
So you're saying if it's really smoky, you could be outside with an N95 mask?
well, if it's really smoky, if we're talking about into the orange or other higher hazardous range, if you're not medically fragile and if you have something you have to do, you can reduce your exposure to smoke by wearing a properly fitted N95. N95 are small enough to trap those tiny particles that are ones that get deep in the airway and can cause real havoc.
Okay, that's great. So everyone, we know there's a shortage of N95 masks, but if you can find one out there, I would suggest it's probably a good time. It's supposed to get a lot warmer the next couple days. So hopefully, something to catch.
The thing we're worried about is that when it gets very, very hot, you can have a layering of air, and if it's quite still, smoke can accumulate. However, the Green Ridge fire is very largely contained, so it's not producing that much smoke. So most of the smoke that we're seeing now, we believe, is primarily from Northern California. And so we're hoping that we won't have bad smoke. But if anybody's concerned about that, there are the two websites that they can readily check. And anybody that has underlying chronic illnesses, heart or lung, should be checking those frequently, and certainly check them if you start seeing that the air is smoking. Thank you.
So the current air quality monitoring I had reviewed earlier today, and we are on the verge of that good to intermediate. So just kind of the high end of the good and low end of intermediate. But we've seen, the smoky skies, and sure enough, if you can see it, you go look at the air quality monitoring, and it jumps way up sometimes.
Right. During a couple of evenings with the Green Ridge fire, we did get into the orange zone, which is in AQI, where people that have underlying conditions have to be cautious, but we haven't gotten into the, if you will, generally hazardous zone. And then we also have, if you go on our website, we have some guidelines for how you can estimate that if you don't have access by your smartphone or whatever to those sites.
Okay, the orange zone. All right, for all you Beaver fans out there. I'm trying to think. So, oh, I know. Our sheriff was wearing a beaver mask this morning. It was, and it was very nice. So, thank you, Dr. Conway. I do believe that we do need to look at the testing contracts. Is Dave bringing that up, Tom? Dave Doyle, would you like to join us?
Good morning, Commissioners. How are you?
We're good. It's Wednesday, and it's already September. How could that happen?
Go. It's going fast. Yes, yesterday we provided you with a boilerplate contract document that we've been working on, and we do have presently two grant agreement documents, which is what the boilerplates were for COVID testing. Those have been approved by the two providers that have been identified, and they're ready to proceed. One of those would require board signature due to the dollar amount. The other one would meet county administrator authority. That's in his range. So those two are ready to go. The additional grant agreements that we've been working on are awaiting approval from the grantees. In this case, we provided those. Finance and legal worked on those, and we're able to push those out to Neighbor Impact just today, in fact, earlier this morning. So that's where we are on those particular agreements.
So I've got just the one for 50,000 here. I don't know if there was another contract that was issued or we were given copies of.
Yeah, there wasn't another one issued. There was a second provider, Mosaic Medical, that their larger piece of the population that they'd be serving took that contract, I believe, just over $200,000. And that document was just approved finally this morning between the county and the grantee as to legal form. It's not been executed. Obviously, the parties need to approve that, and the board would have to approve that and authorize.
But we only allocated $200,000 total for that.
For testing.
I'm not sure on that. I'll defer to Tom or.
Right.
So I want to, before we even get into the amount, I was just wondering what the process was in terms of determining which entities we were going to give testing money to. Apparently, originally, it was all going to just the one facility, and I was just wondering, was any outreach made to other private sector testing entities, which there's quite a few of, to do some testing, or just how did that decision get made?
Yeah, my understanding, and I think Dr. George could speak better to it, is that his staff did reach out to multiple providers to see what the level of interest was. I will note these are grant agreements, and so they operate outside of the traditional procurement processes. And so it's a little more streamlined of a process. But I see Dr. George just popped up on the screen, so I assume he could speak to how that was vetted.
Yes, the larger one was at our request, Health Services, and our concern was serving homeless people and people that are medically indigent. And we had seen a number of concerns, including in outbreaks where people had wanted testing and couldn't get it except to pay quite high amounts cash. Sarah Holloway is a nurse on our staff, senior nurse on our staff, who her normal day job is running the nurse home visiting program, but she's also serving as our testing lead. She maintains a lengthy list of providers in the county. And then the criteria that we set was we wanted it to be mobile and to use rapid testing technology, so that because many of these people don't have mobile phones, so they could be tested and get the results while they're waiting. So she went through the list, which she's updating frequently, and there were only 3 local providers that were able to do the rapid, what's called point of care testing. She reached out to each of those and asked them whether they had an interest in doing mobile testing for this population, and the one that responded, which is Mosaic Medical, is the one that we then undertook to try to work collaboratively at a way of meeting that need with the resources that are available.
So, and these are all contracts up to an amount and to the end of the year. So they're, they may or may not expend the funds agreed upon. Is that correct?
That's correct. Those are not to exceed dollar amounts. The one provider is not to exceed $50,000 for testing, and the other one, I believe, with Mosaic was just a little over 200,000. If
Over
that puts us over
200,000?
what the board had allotted, I'm not
We
really
didn't,
aware.
we didn't even allocate for over 200,000 in our allocation.
So if I may, the 200,000 one, I increased to 207,000, with the remaining 7,000 being covered by our department, because we have to allow for up to 4% of the specimens that are for people that are being tested for symptoms may come back negative in the rapid testing. So those folks would need then to send those for testing to Hillsborough, to the state lab, and that's a unit cost of about $100 each for the shipping and handling. So I added that $7,000 to that, and it's clear in the contract that that's to be debited to our departmental funds.
Well, I appreciate the effort to include the sole provider. She's been somebody that's been, from the very beginning of this, over 5 months ago, very helpful in terms of developing testing, researching testing, et cetera. I'm anxious to see. I know she's doing testing, and this offers an opportunity for really a private sector person. She came to us about the volunteers in medicine population, and Commissioner Adair, I appreciate you making that happen. I mean, we'd agreed that it should happen, and I'm glad it did. I guess so thank you for that.
Thank you. But what about the fact that we're now over what we allocated, when we allocated 200,000?
Should we be cutting back the other one for the?
Well, it just seems like, is that good government? We allocated 200,000. Okay, so if 7,000 wants to come from outside sources, but I mean, okay, look at our numbers. Look what our numbers are doing. 200,000 seems
Are you
like.
proposing we cut the one so that we match the budget of 200
Right.
total?
I mean,
that-
if we set it up for 200,000, are we not respecting our financial decision-making that we made?
If I may, Commissioners, our original request for just under $500,000 to hire two providers, and that was reduced to 200,000. So we resubmitted a request for 200,000 for the purpose of rapid testing of the high-risk, underserved groups. So the submission by health was within the $200,000 as approved at that time. Since then, my understanding is that an additional effort was undertaken at your behest, and we have provided technical input for that. So I would suggest the cleanest way would be to consider that as an additional approval.
Yeah, I think, though, going back, I mean, we've been advocating for testing by the county and funding for testing by the county for several months. And so
Since March 13th.
I'm really glad the health department is doing this, which we've been advocating for. I don't know. I think, again, apparently the decision was just made to do the one. And so I don't know. I'm kind of with Commissioner Adair. It'd be a reapportionment unless we have the ability to come up with another 50,000. We're going to talk through the rest of the CRT. Maybe we could put it on hold for right now until we get through the rest of the CRT funding. I don't know where we are on those numbers. There may be an availability for 50 more, but what do you want to do?
I think we need to look at what we're doing with the rest.
The rest.
Okay, so where do we take 50? I mean, is it that good government to allocate 50,000 more than what we said? So, yeah, no, we need to look at it. And, we've got some really important things over here, childcare.
Mm-hmm.
And I know we're not funding them 100%. We're doing what we can, so.
There's a lot, yeah.
Yeah, there's a lot of things out there. And look at our numbers right now. Okay, so we're doing, over 1,000 tests a day, or a week, 1,000 tests a week. you know,
So-
how
so
many of those do
Commissioners,
we
if-
have to cover the cost of? And I don't want to hear about anybody having to pay $2,500 for a COVID test. I think that is horrific, and that should not be happening. But, you know, I just
Is
feel
your
like,
understanding it is? I mean,
well, no, I know it. I did hear it happen to somebody, that they were charged $2,500. I'm not sure if it was in Deschutes County, but it was in Oregon. They got a bill for that amount. So that's definitely not something that we want to happen. And I know there's a lot of people out there that are worried. They want to get a COVID test, and they're worried they don't have their insurance, and they need the test, and they should be able to get the test. We should be able to provide that.
So Commissioners, if I may add, so the testing numbers are still reasonably robust. So what health did was look at the unmet need, and we believe that that unmet need is substantial now, and we're very concerned about retaining that functionality going into the flu and potentially the COVID season as people go indoors. So, and the $200,000 was down adjusted from the original request. So we have been compliant with the process. So I hope that you can find room to fund the other one which was not done at Health's suggestion or behest.
well,
Actually, Dr. Conway, starting March 13th, I asked for the employees of the long-term care facilities to be tested, because those are our most vulnerable. And did that ever really happen? No. So,
Actually, we've been working on that since the very first case at long-term care facilities, and we had actually advocated. I was on the advisory group that the OHA convened to look at the long-term care testing strategy for the state. We were one of the principal pilot sites for that.
that was months later. Look what happened in Kirkland, Washington. All those people passed away because of COVID got in there, and we knew when we started with COVID that it was going to be a serious problem. So in June, we finally get things tested. It's unfortunate it took so long, and I feel so badly for, we have 24 long-term care facilities. Did we hear today that they've all been now tested, the employees?
Yes. Actually, we are fortunate. I didn't want to take up more time with the COVID briefing, but we are at a point where all have been tested. 6 of the concerns where there was either an actual outbreak or there was at least one staff member have been put to rest after 14 days. There are only 2 recent ones, each of which have 1 positive staff person is being followed. And there's the most recent round of one of those, all were negative. And the second one have been negative so far, but we still have some tests outstanding. So in general, that picture has improved markedly. And Commissioner, I have to agree with you that long-term care testing cross-sectionally is one of the things that we pressed for very early in the epidemic, and it took the state.
It took us over 5 months.
No. I'm sorry, Dr. Conway, if I didn't want to get in this discussion, but we had approved as a board that we do this testing of all, find a way to test all of the staffing. It came back the next month or next week or so, and we need to get the minutes maybe to do this. You'd come back with this proposal just as a health department deciding that we couldn't afford to do it, so we're not going to do it. And we complained about that. So the next week we hear, or roughly the next week, we hear, oh, we're going to be able to do it. We've got this other way to do it. So in my mind, that's shut. You're doing it. Great. That's what we wanted to do. Then we hear a few weeks later, no, actually, we went into a pilot project with the state and we only did 5. What was never asked was whether the county commissioners would approve a system to systematically test all 24 facilities. All of it was done independently by the department. We're not consulted about it. We're not asked on the first time whether it's too much money. It was just decided it was too much money by somebody. We're led to believe that you found another way to do it. That turns out to not be true. So now it's maybe done in the beginning of September. But luckily, unfortunately, one facility did have the serious outbreak and deaths that maybe could have been prevented if we'd done what we'd said originally. Fortunately, others didn't. But that's my recollection of our involvement as commissioners with the health department's involvement with this whole testing thing. And I'd be willing to research this, but it's kind of moot now. But the point is that it kind of goes again to this testing. So we decide we're going to spend $200,000 on testing from the CARES Act. What was never asked was, well, who should we be targeting? Now, I don't disagree with who you've decided to target, but Mosaic is a facility that only serves a certain portion of the population. There's another portion of the population that is not getting routinely tested at BMC or in St. Charles that also has a cost to bear that we might, and I know I would, be interested in how do we reach parts of them too, because I've heard other medical providers complain about this publicly, that the big entities aren't testing in that area. Well, again, that's this issue of what's the scope of what we'd like to see tested, not just what the health department would like to see tested, because we're here to allocate these funds as best we can. And there's a broad population here. And there are many people that are not getting tested because of the cost, but they aren't going to go to Mosaic because Mosaic only meets a certain stratum. So that's the kind of discussion we should be having, I think.
So, Commissioner, if I may, there's a community, there's ad hoc community testing planning group, which was organized by with invitations to all the people that are listed as being available testing facilities on the website. I believe there's 29 in Deschutes County and others from around the region. All of those were invited to join this group. We have on average 7 to 10 of those joining the biweekly meetings. We did canvass them at the time that the amount for testing was allocated. We did a survey about what the highest priorities would be. So this was responsive to that as the highest unmet need, being individuals that were homeless and those that were medically indigent. So that was the input for our going forward to do that. As far as the long-term care testing goes, it is unfortunate that was not mobilized at the time that we, at your behest, did put forward a plan to do testing regularly through the end of the year. What did happen was the state did start leaning forward on that and decided to go forward with a plan. So we did testing, made it available on a liaison basis for any of the care centers that wanted to do that, and then worked with the state to stand that up as quickly as possible. And I do wish that it had happened much faster, and it might have prevented some of the exposures that we've seen.
Well, but that's not my point. My point is, I wish you would have asked us what we thought we could do. That's what I think is missing here. And again, it's interesting that all these groups identified who they thought the testing should go to, but there's another whole portion that doesn't have advocates that are citizens of our county that have a similar problem and aren't getting the testing that maybe they should because they're conscious about how much it costs. So I'm just saying, don't always go to the institutions to tell you what should be done. Maybe the board should have some opinion on this, and we should be consulted with this, because we are out there with many different kinds of people all bringing up the same issues. And so it's not just a agency-driven system.
Right.
Commissioner, I think that's an excellent point. We've asking all of the people that are listed, all the providers that are listed of those 29, to provide us information on which ones provide testing for those that are uninsured and at what price point. And we're currently surveying that, and that's one of the outreach efforts from the community testing work group, and that information will be posted as soon as we have the replies. I'm hoping the next 2 weeks. In the interim, anyone that has those questions, we are doing our best to refer them. There's 2 providers that we know of that are doing that.
But again, you just referred who's uninsured. That's not the only issue. There's the ones the people that are insured that the insurance doesn't cover, maybe, or something that they have out-of-pocket costs that's keeping them from being So it's a broader issue than what you see, is my impression.
Actually, we're aware of it's a very broad issue. Part of the issue is that there's public funds under CARES Act to reimburse and cover the testing cost itself. But there's also the astronomically high bills, like the one for $2,500 that Commissioner Adair mentioned. If somebody goes in and they have to be assessed, then there's different billing codes. It's very, very complicated. And I wish that we were working in a system like many other countries have, where it's much simpler and less difficult to navigate. It is one of the roles of public agencies such as the Health Department and the federally qualified health centers such as Mosaic and Lapine Community Health Center to try to help the populace negotiate these kinds of barriers, as well as providing them to our own clients. So I'm very sympathetic that this is a less than ideal system. There's very little cost transparency, and there's very little clarity on what the de minimis.
Well, I'm not going to go off on a
There's definitely
discussion of the
cost.
health, this health system that's ideal for our country or whatever. I'm just talking about who do we get this CARES money to, and what populations do we reach? And there are some that I think need to be considered that haven't been so far. So,
Well, I just think it's good news that Dr. Jeannie Young in Deschutes County, we are allocating for her to test up to 500, not to exceed 500 people. So I spoke to her this morning, and she is out there working in the community. And, she's been working at this all along. And I do appreciate that she is a private provider. I think it's hard for private providers to, she's very compassionate about her medicine, very, very, very compassionate about her medicine. So if you need to reach her and you can't, please go on our website or let the Board of Commissioners know, and we'll get you her number. So where are we at now? Well, we're still discussing the testing contracts, I believe.
Commissioners, I think that it sounds like you're supportive of the $50,000 contract, so that's within my authority to sign, as Dave said, so I'm happy to do that. It sounded like you wanted to revisit the CARES Act allocation before committing on the other contract, the Mosaic contract. So I think we'll hold that one in advance till later today when we have that discussion.
Right.
The only other COVID item on your list today was consideration of extending the emergency declaration.
Yes, the emergency. Did you all get that in your packet? Dave, did you want to bring that up for us and clarify?
Sure, Commissioners. As you'll recall, you've, after initially declaring an emergency, you've extended it on a 30-day basis, and that extension latest one will expire on Friday. And so this is your last board meeting. Prior to that, we have it written identical to the previous extensions, which would extend it an additional 30 days, which by my math would take it to October 2nd, meaning if it were going to be extended further beyond that point in time, you'd have to reconsider it at your board meeting on September 30th. And again, as noted previously, this is to make sure we don't have any gap periods where there could be an issue with regard to certainly FEMA reimbursements. It also does make for some easier procurement and contracting processes as might be needed.
Thank you, Mr. Doyle. Do we have any comments?
Well, acknowledging that we're working through the CARES Act funding right now, and the supplies, the PPE supplies, as we discussed, and trying to do purchasing, this is very appropriate to do this 30-day extension. We're just in that rolling kind of business phase of this pandemic at this point, so I do support extending it 30 days.
Is that a motion?
I'll move approval of order number 2020-050.
And my only comment is I don't know when. I kind of wonder after we've done this a bunch of times, how far it rolls forward and how long. But I agree with your analysis of why we're doing it and what we're doing. So I'm supported as well.
So that's a second.
Second.
Further discussion? Commissioner DeBonne?
Yes.
Mr. Henderson?
Yes.
And the chair votes yes. Thank you, Dave, for preparing this and for all your work on our contracts. I appreciate you stepping up and always taking a look?
I've got a lot of help from health folks and late Greg Munn in finance, a lot of help, so thanks to all of them.
Great. All right, so now it says we have continued discussion of our CARES Act funding. I see Mr. Mann on the screen as we speak. Greg.
Okay, Commissioners, so last time we met to discuss this was on the 26th. And at that point, I let you know that we had about $4.6 million available in CRF funds to be allocated, and or at least originally, and you had committed or allocated $2.5 million of that on the 21st of August. So the exercise on the 26th was to discuss the $2.1 million of uncommitted allocations. At the point, we left that meeting with 5 to-dos, follow-ups with some additional information, and come back to you today. So we have, again, we're working off the sheet with the green shading on part of it. The items remaining to be discussed, at least at the beginning of today, were the ones that weren't shaded. And I've asked that the folks who are experts in each of these areas be available on the phone, including a proposal from Better Together that was placed in your box this morning. They're on the phone also to answer questions.
Okay.
So with that, I'll turn it back over and let me know if you have questions, and we can bring on the experts to answer those as we go.
Okay, so item number 1 is the ventilators. We wanted more information on the region-wide capacity and what is needed when combined with St. Charles inventory, where they felt they were. I see, Dr. Conway, you are ID'd for that point. Did you want to get us up to date? Yes, please. Thank you, Stephanie. Where did Will go?
Yes, I've just been reopened as a panelist. Thank you. We did meet with Sergeant Nathan Garibay, and I did meet with the muted. But can you hear me?
Yes.
Yes. Yes.
Okay. I don't know why it said that. We did meet with Nathan Garibay, and I did meet with Dr. Jeff Epsilon, who's one of the senior physician executive CMO for the practice group at St. Charles. We went over existing inventories. There do appear to be 80 available ventilators currently, with 10 that are on a rental basis. We have inventoried, Nathan's gone over these numbers before, but we have some of the transport ventilators that we had ordered are still en route. On the St. Charles, and the three of us agreed that it would be prudent to go ahead, since those are primarily used for transportation and EMS services and could also be used back up in the hospital. I believe there are 2 or 3 ICU style ventilators that are still in the pipeline. And I'm sorry, I thought Sergeant Garibay would be available to talk about the actual inventory numbers, but it would be helpful to have those. Proceed with the purchases as they were made based on the earlier CARES Act allocation. If there's really technical questions about which of those are purchased and paid for and which ones are still in the pipeline, I'd refer you to Sergeant Garibay.
So 16 is the number that was
requests for
provided.
ventilators in this current CARES Act request. I don't believe there are any new requests for ventilators. That was a residual from the earlier approval a few months ago.
So 16 are on back order?
No, 16 currently in cash is what was provided to us today.
Oh, that's right. So, and we'd ordered, what is it, like 32 or something?
I believe there were 30. I believe there were 30 ordered. 20 of the 10. The
So bottom line is, did St. Charles think that they needed more capacity for a surge event, or are we at a spot where we have the capacity?
Well, we all agreed that it's impossible to know. This provides additional surge capacity. I mean, if we end up in a very bad circumstance, such as happened in New York and New Orleans and Chicago and whatnot, where we're having to stand up additional use space, we will regret not having them. On the other hand, if it doesn't happen, then some of this equipment will continue to be useful as inventory for preparedness and readiness and flu outbreak.
So could you summarize again how many the hospital has?
He said
The
8.
hospital has a total of, I'm sorry, once again, I thought that on this part of the call as well, but the hospital has a total of, my understanding is they now have a total of 80 available, 10 of which are on a rental basis, so 70, which is a slight increase over the inventory that was available at the beginning of the COVID epidemic.
I think the reason we were looking at, or we had ordered 30 more as we were trying to be a backup again for regional supply. And I guess I wonder, I think what we were asking about is whether we, since it's taken them 5 months and we still haven't got them, even though we see on the news about ventilators being made by the hundreds of thousands, it's like, well, maybe we should cancel the order because we didn't use anywhere near the 80, I think, and let alone the 30 more.
So I should point out that, and we reviewed this as
Right.
well.
Yes.
So the majority of use of ventilators by any hospital is for temporary support of individuals that have been anesthetized or otherwise recovering from surgery, from elective surgery. The great utilization of that is for the routine medical care and emergency medical care outside of an epidemic at the hospital. So we appreciate that St. Charles has ordered some additional inventory. In a discussion, we agreed that the transport ventilators, because they're dual purpose and there's many EMS services that don't have them yet, it's very important to have. So there's a question about whether we should go through with that. And the reason we don't have any of these is that they're still behind in manufacturing. So this is inventory that we ordered months ago. The only question at hand in play was whether or not we should get the additional few. And once again, I'm sorry, I don't know what that number is. It's
14.
a few of the ICU ventilators that are still in the pipeline. And St. Charles said that they thought it would be helpful and useful, but that's the most we can say. They're not highly expensive. The transport ventilators are cheaper. Even the ICU ones are not terribly expensive, and that amount was already set aside. So
what does that mean? What's not terribly expensive? 10,000?
Sorry, Sergeant Garabay is the one who would have to answer that. I don't know the unit cost. This is not the kind
Isn't
of.
HUD still on?
But
No.
I guess maybe we can't answer it today, but my view is that we should take another look at it and see. I hear what you're saying, Dr. Conway, that the hospital thinks it might be helpful. Well, it's not. I guess we're looking at would this, if it's $100,000, would that be better spent on testing? We were talking about that
I don't think there's anything like 100,000 left in the unfilled inventory. But once again,
maybe we can get some clarity.
I thought
by
it was
Monday or
70,000 was left to be spent.
Sergeant Garabay will be joining the briefings that we usually provide weekly for each of you tomorrow. I'm sure he'll be very happy. It's about a different subject, but I'm sure he'd be very happy to answer that. I understood that he had covered that earlier today because he needed to go early, and I'm sorry I don't have that information in my hands. That sort of inventory control isn't, and order fulfillment is not.
It's kind of like, this, as we've gone through this crisis, there was the no mask period, and then there's the everybody needs a mask period. There was we needed hundreds of thousands of ventilators. New York didn't even use all the ones they had, so then there's kind of well, maybe we don't need as many ventilators. So it just seems like there's this changing mark, and it's always good to have more supplies, but I guess that's the question is how much should the county have, and maybe Sergeant Garabay can give us some more.
Right.
Right. If I may, there's undoubtedly an element of guesswork, there's probabilistic models, but there's also guesswork. If you remember one of the reasons that we did the joint messaging with St. Charles early in the epidemic was because Michael Johnson's model showed that we could be overwhelmed.
Yeah,
with,
that was wrong.
And we were going to have a spike.
We don't have any, I'm sorry, but we don't have any idea of how much we need. What we do know from experience is if we get to where things are very, very bad, at that time, procuring additional ventilators, given our relatively low population size, and additional PPE will be all but impossible. So that's the only contingency that we're talking about.
That's why we want to get the PP&E. That's definitely something we recognize that, yes, we can't count on the state for that. So
Okay.
anyway, okay, we'll wait to do that later. Yes, we'll come back to that later. So, Greg, do you want to, should we hear from Becca Tatum then?
Becca Tatum.
Good morning, Commissioners. Thanks for having me back. You have in front of you or in your boxes a written proposal which is hopefully fills in a whole lot of the detail regarding the specific programs that we discussed, but I just want to go over some of the headlines. So at this phase, we, with the tireless work of 9 provider partners, stand ready to roll out full-day school-age childcare, and by that I'm talking about 9 hours a day, 7:45 to 4:30 or later, 5 days a week. So 9 providers at 24 sites across the county, in partnership with our schools and with providers, the parks, our clubs programs, Circle of Friends and Sisters. And the goal and the current capacity with that is to be able to serve 1,000 children across the county in K-5.
And how many are there actually in the county that K-5? How many children are there? So if we're only serving 1,000, how many are we missing?
Sure. So in K-5 countywide, there are 12,000 children in K-5. So we are still only hitting a small percentage of the total number of kids that would be returning to school, next week. What else do I want? And I guess the other statistic around that 12,000 is that we know that roughly 45% of those families, those children would qualify for free and reduced lunch, so might have limited disposable income. And we also know that some percentage that there are there's a percentage of our families that don't have work flexibility. So our essential workers, who are our police, our fire, our emergency services, our medical care, our nurses, our construction workers, our warehouse, our fulfillment. So the 2 populations that we are prioritizing in serving and enrolling in these programs are those high need students who would be possibly left home alone, or would, parents are scrambling to find another solution so that they could go to work. Also, obviously, the learning piece is important, having some supervision for a 6-year-old in doing their distance learning. And then those families that don't have disposable income to pay for childcare. So the request before the commissioners is a little more than 1/4 of what we estimate the total cost for 12 weeks. So we're looking at this as a September through December. I'll talk a little bit about what we imagine will change when some kids get to go back to school. But so the total cost is about roughly $2 million, a little more than $2 million. Our partners have worked incredibly hard to bring their own resources to the table. We have in-kind support. That $2 million is probably, it does not include lots of administrative overhead and other in-kind contributions that we see our schools providing, and that we see our providers providing. And so what does the financial model look like? It looks like a wonderful cross-sector partnership of partners like the county, partners like private funders across the region, and so private funders who've invested in individual programs that they support, and other partners, including the City of Bend, and then some pending requests that Better Together has submitted, including a request that's out to Oregon Health Authority that would supplement some very targeted populations in the kids we want to serve. So it is an enormous effort. I would publicly thank our partners in Sisters and Bend and Lapine Parks, the Boys and Girls Club, Reach in Redmond, Champions in Redmond, Campfire, the High Desert Museum. This has been a really remarkable 3-week sprint to be able to serve all these kids. One note on sort of what does this look like? We all want our children to return to school. The numbers are looking better. So what does that mean for planning out for a program like this? And so you'll notice that, so in short, 1,000 is still a small drop in the bucket. When we talk about serving K-5, we hope that our K-3s will return soon. And we know that there's some possibilities that parts of the county will see their K-3s return sooner than perhaps the Bend Lapine schools, which has sort of made a pretty hard commitment to an early November return. Even when that happens, our K-3s will likely go on a hybrid schedule. So for families that are working a full work week, they're going to need to continue to utilize the care that we're providing on the days that children are not at school. And then, as you all were talking about earlier in this conversation about the gap or the cutoff point, obviously that leaves our 4th and 5th graders not able to return as quickly. And so with some of our programs where I know in Sisters Parks is particularly earmarking those students. They're saying we want to just stand up a program that is going to potentially continue all the way to the winter holidays, to the Christmas holidays, and just be able to provide continuous support. So I know there are plenty of other questions. There's a lot of detail here, and I'm coming with a large request, and I know that there are many needs across the county. So I welcome your questions to help clarify kind of how all the pieces fit together.
So I have a question. From the metrics we saw today from our health update, COVID-19 update, it looked like K-3 actually is below their required mark for the last 3 weeks. So it seems like they could, a case could be made that they could open next week if this week's, so that's one issue. So do you have to then integrate these programs' timelines so that we get the kids after lunch or we get some before? I don't know how the schools are doing K-3, but it seems like that's a variable situation right now.
Yeah, that's a good question, Commissioner. And I am, while I have been working closely arm in arm with the superintendents in the schools and their rollout, obviously those decisions are within their realm. But my understanding is that as we're pretty deep in the logistics of planning access and use of school facilities. And my sense is a pretty clear commitment that return to school is not likely to happen sooner than late October, in at least across the Bend Lapine School District, which still leaves us with a huge population of kids.
Even with that metric, even with the
6
metrics we're seeing right now, you don't think that they'll go back to school? Even with the metrics we're seeing right now for K-3, they won't go back to school till late October?
I need to be clear here that I'm not the authority on that, but I can address sort of the logistics of how we have been planning to address the shift in terms of when kids are going to return to school.
Okay. A second question I had is, you say essential worker. We've been involved with some grant giving. We have to set up criteria, and it's popular to say that the essential workers are these people, but I've had a belief that most people see what they do as essential. And so it's really, unless we're in a huge emergency bigger than this, I just feel like most people feel like it's essential that they have a way to pay for their food and their rent and everything else. So I don't see that as being as helpful to you deciding who does and who doesn't get into your programs as, I don't know. Do you have any thoughts on that?
Yeah, no, that's a really important clarification. And just to be clear, the language in the proposal that I've shared with you is not meant to suggest selection criteria. And frankly, given the immense need for families across all professions and across all income levels, what we are finding in those programs that are enrolling already is that we are working very hard to encourage all interested families to apply. We're also beginning to address the, sort of what a sliding scale or other supports from potential workforce contributions and other resources might look like to reduce the cost for families that are, that are saying, hey, we can't afford $200 a week or $150 a week. So thanks for that clarification. This is not meant to present a selection criteria, but rather to acknowledge sort of some aspect of the need, which again, the need is far greater than the spaces we're able to find.
So you're actually only providing services for 8.3% of the kids that are in that age range.
So to clarify, this program, which I come to present today, is our phase one. This is who we were able to tap and quickly say, we want you to stretch beyond what you were planning to do, and create a full day program that includes a close partnership with the schools that has academic support, where we're going to actually supervise distance learning for students on site. So this represents those childcare partners and heroes who said, yes, we will do this thing. And so that's everything from our parks, Sisters, Lapine Parks, Campfire, which is typically a after-school program, the Boys and Girls Clubs, which, all of those. So that's just phase one. What comes next, and in fact, which is already in the works and conversations I'm having with other community partners, is okay, we focused on what could happen quickly. Now we need to come in with that additional level of support for all of the other pieces that are out there. The families looking for learning spaces to share childcare or supportive learning. The community partners in our churches that have said, yes, please come use our facility and we'll help with volunteers. The retired teachers who want to be a Zoom mentor to children. So there's a lot more to follow. This is where we're able to concretely say, this will happen, this is happening, and this is where we see a wonderful lever for the CARES Act funding to, in fact, allow us to do it. Does that help to answer your question? It's a start. It is not the whole solution.
Or is part of this these programs that all these different groups will offer helping with the online learning if the schools are requiring that? So you're going to have people trying to get these kids to pay attention to what they're supposed to be doing.
Yeah.
Good luck.
I mean,
yeah.
It's local parentis.
Yeah. Well, a lot of parents will be helpful that these programs are doing it, because the parents would have equal challenges, I'm sure. So,
yes.
Okay. And then it doesn't look like any of the particular private entity childcare are part of these programs. Do you know if there's anything going along in that area also, or?
Yeah, that's a great question. So as you know, we've been working closely hand in hand with Neighbor Impact and the Early Learning Division within Better Together. And while I don't have a number in terms of here's the number of children enrolled, we know that there are providers across the county that have taken in, particularly our K-1 or K-3 students. So what that looks like is that in-home licensed provider that's taking older siblings, or the preschool that has opened up a school-age room where they're essentially doing the same thing, supporting the distance learning in some format, but also for families keeping siblings together, having children in a safe place when parents have to be at work. So I'm sorry that I don't have a number. What I can say is that we are working with Neighbor Impact, which has really been the point of contact, I think, historically in supporting those providers. And so my sense is that some of their efforts and perhaps funding will be able to be a resource to that. We obviously at Better Together want to be part of that solution as well. This is a 0 to 17, 0 to 12, 0 to 10 problem we're facing in the short term.
So what are your thoughts if we came up with 200 or 400,000 instead of 650? Is that really blow it up, or could you scale it?
So that's a great question. A couple pieces to that. So when you think about cohorts, so under the health guidelines, we're working with cohorts of 20, which is what's permissible in one group of children. So the unit cost on a cohort of 20 is the same as the unit cost on a cohort of 15 or 12 or 11, because the biggest cost is staffing. So part of why this is such a large request is this is a lever to give the program's capacity to serve as many children as they can, as early as they can. Is there ability to scale? Absolutely. And as we think about, what is it, they're planning on training staff next week and hiring staff at the same time. We will see, I think, particularly in Bend, some situations where there's a cohort added once the staff is available. And I will say that our push is to give children and families as much continuous support as we can, which means having the cohorts filled to capacity as soon as we can possibly do that.
So it's probably more important to make a decision about X, the amount, today than to wait a week and analyze it more. I mean, I'm almost seeing that right now. Also, then the balance between Neighbor Impact and Better Together. And I don't know if Scott's with us again, because we have these two line items, 400,000 and 200,000. Is that totally two different worlds, or do those interact? So we'll see if Scott might be available too. He's joined us each time we have this conversation.
And I would say to that we want to be very clear that the work of Neighbor Impact in their sphere is incredibly needed and is a lasting impact on our childcare capacity. And so I would not advocate for dollars to be reallocated from them to this request.
Well, and I'm just thinking of the balance, as in if we're already looking at two line items that say 400,000 and 200,000, are those two different programs that don't not communicate, but don't have the cause and effect, or is there a lot of
we're talking about
crisscross?
setting up a whole new system, whereas we do have the child care that's been totally devastated with the numbers, and we don't want to lose those, because actually our COVID numbers are looking better. What you need will only fund 3.7 weeks of the county money if we would give you 650,000. And that, that shows you that that's really not very, it shows you why we need our schools back, because it's extremely expensive. And what you've done, you've brought together all these people, and it's amazing. But, I think every item said high need, high need, high need. So what if you're out there and you have one high need, but then you have a regular, or, is everybody in the family considered a high need? I don't know what your definition of high need is.
Well, and so that's a good question for clarification as well. With the larger programs, part of their revenue model, and it is and has to be families that can pay something, or that could pay the full cost. And so what you see, particularly in the Bend Parks program, which is the largest, it's going to be 560 children at 14 sites. They are looking roughly to enroll half of those families that participate will be paying $800 a month for their children to participate. Now, honestly, that's still cheaper than the going rate for lots of other childcare, and certainly than an hourly babysitter. That's still kind of roughly $4 an hour. That is the other large program that's operating in Redmond is the Champions program, which is operating in 4 sites with more than we're hoping to increase their capacity. They also, they work with families on a fees for service basis. Our other providers do that as well. So part of the flexibility there is some flexibility to enroll families and ask for fees for service. I think that where I would draw your attention very specifically to South County, where we are having this incredible effort with 3 separate providers to stand up programs in the 3 elementary schools. And because of their staffing capacity right now, those are small cohorts. Those are cohorts of 20. My hope, working in South County and other capacities with Habitat, is that 60 kids in South County, I want to serve the highest need families. While I know we could recruit and find families that have disposable income to enroll in those programs, I think we can all agree that this is an opportunity to really be of service in a way that reduces stress for families that are under a lot of stress already. So that's one section of this proposal that I'm hoping we can fund as fully as we can. I think, but similarly, the funds requested for the Boys and Girls Clubs and for Bend Parks, while those are large dollar amounts, the goal there is to really allocate that money directly to families that would not otherwise have other options. Knowing that all of this is a drop in the bucket. And as you said, commissioners, we want school to return. I recognize this is a large request, and hopefully I'm able to give you some of the parameters of the business model and how we're thinking about this.
So,
Yeah, thank you.
So, commissioners, one thought I have is that, this money is coming from the federal government through the state to us for the county. We've allocated over in columns 1 and 2 some just to county, the county government expenses like family leave, emergency operations center, all of the communication, the testing, leasing space. There's quite a bit we've allocated. So maybe we wouldn't, if we were trying to get more money for this program, maybe we don't do the county facilities things, or we reapportion some of the others. I don't know if we've already turned our request in for the others, but do we carry some of the emergency operations centers and reduce
Yes,
that to 400
like the
instead of 500?
62,000.
Or the leasing or whatever, because it really isn't just to fund our government structure, it's to fund the county, for the people of the county. So that would
on
be
that,
one thought I have.
On that D item, for other and county facilities, we took that to 200. One of the options might be to say that could be left for possible reimbursement at the end of the year, because we're talking September now.
Mm-hmm.
We're trying to empower people to stand up some programs.
Yeah.
One of our items in there is Circuit Court at the Fair and Expo, so that is very much a reimbursable COVID-related activity. But we could also think of it as our, capital facilities, and we do have resources at Deschutes County for reimbursement if possible. So like make that category that we could absorb as a county.
Well, in the lease space, item number 1 that we did approve, that 62,000. I mean, gosh, that's already an expense of Deschutes County.
Yeah.
I mean, it's definitely legitimate
Well, and
expense,
I'm not
but
talking
we
about
could,
making.
but we could move
going
that one out of
backward.
it because we need to put more money in here.
Yeah. So as I say, for that 200, we could put it in the category of plan and getting reimbursed, but not think of it as possibly these dollars. And maybe all these dollars aren't going to go into some programs, as I say, like the business support grants is another one that jumps out. Are we at a phase where people are going to be looking for that next capital for business, maybe not capital, but just grants, or not? Stabilizing a working family is a heck of an investment in small business.
Well, and again, on that one, I kind of agree also, because the second round of the Business Oregon grants went through, and I got the report last night from Scott Aycock that there was 250,000 more to distribute. The latest request got another 100 distributed, so there's still 150. But then there's this other big chunk of Business Oregon grant money coming, we think, that will also be for business supports with less restrictive rules than what we've had. So some of the people that got some federal money, that might be something we could lower. I'd be inclined to lower that. I'm not sure if I'd strike it all yet, because we don't know that other's going to come. But I like this idea of reallocating some of these after hearing that. I wonder if we shouldn't get to I'd propose we get, another one is the environmental health fees. We're going to hear from Eric today, I think, and Tom, so maybe we'll know a little more about, you know, do we need to give 100% to all restaurants, or would 80% be a good, you know, because we're prioritizing all these different needs and it's complicated. So, so maybe we should leave it at that and go through the rest of our presentations, because we also have 4-H coming and
Yeah, we do have
So,
4-H.
yeah, we could make, well.
Environmental
the
health.
conclusion is to make some decisions, especially towards this Better Together, standing up these programs today. I'm just advocating for that.
Yeah,
One way or another, because you can just see it. There's going to be a domino effect of choices real quick here.
yeah, I agree with that. But we got a couple more presentations, so we could.
Thank you, Becky. You're doing a great job up there on the video in our meeting.
Thanks for the putting it on paper so we can kind of see the details. That's really helpful in working on this.
Thank you for your support, commissioners.
So 4-H is only asking for 15,700 total needs.
Is it?
What is that?
The 4-H, their draft is for, let's say 16,000. So,
This really gets more, this gets more into the issue of what we had done with our resolution of keeping people active, isn't it? Isn't that part of the 4-H?
right.
Well, and I think this Better Together partnership is very much that also.
But 4-H isn't doing online learning for kids at school, are they? I mean, it seems like it's more just about more 4-H.
Yeah, extracurricular, but I mean, life
Well,
balance.
kids need to be
And
engaged.
project goals,
Yeah.
yep.
Oh,
They're definitely up there for engagement, so I think it's, you know, it's 16,000 for 4-H. Okay, all right, so, Whitney, do you want to explain 4-H at all? Any additional information?
Actually, commissioners, we have Candy Botham on the line here.
Oh, great, Candy.
At the end.
Good afternoon, commissioners. Thanks for giving us a few minutes here. Rebecca, kudos to you guys. What a cool thing you're doing, and huge program. I wish we could help out there a little bit, and we may be able to. So let's hook up and talk about that. So commissioners, my proposal that I submitted to you is really about a couple of things. It's about keeping youth engaged. It's about training volunteers in order to keep youth engaged. And it's about supplementing teachers and parents who are doing online education, specifically in science, physical education, and outdoor education kinds of ways. And so what we're looking at is taking an hour of their day and teaching science, or an hour of their day and teaching technology, or taking them for a nature walk, things like that. And so, and in addition to, of course, keeping our regular 4-H kids engaged, these would be things that would be open to all youth as well. We also, OSU has designed some babysitting curriculum, and we're looking at implementing that in ways to help with the child care issue, because we know it's a huge issue. And so, of course, we also have a facility that may be available for such things as well if there's facility needs. So, what questions can I answer?
So this $15,700 unknown line item, is that the request to us today that's going to help you move forwards?
Yes.
That is your official ask, correct?
Looking at my budget here, this was all put together fairly rushed.
It's the
Yes.
draft budget,
It's in red.
COVID-19, keeping youth engaged.
Unknown. Candy, it's at the top of the budget. It's under income. It's in red. So I'm assuming that's what you're
Yes,
asking.
I'm sorry. Yes, that is correct, Commissioner Dare.
Okay, great. No. Well, we were so proud of what your team did putting together the auction. You did an amazing job with flipping it and then flipping it again, and, you know, amazing flexibility. So I just want to thank you again. And I'm sure the youth that were able to sell their animals and put some money in the bank for college, or their future is really great. So thank you for I'm sure you didn't sleep for about a week.
Well, it was longer than a week, but we certainly appreciate your support and commissioners and the staff at the fairgrounds as well.
Longer than a week.
Couldn't have done it without either group.
Okay, well, great. Well, thank you again.
Well, so I would maybe propose that like in our spreadsheet under column C, that it's a standalone item at that amount.
Yes.
Item 5, just because it's a very specific thing.
Yes, I agree. Is that okay, Commissioner?
Yeah, I'm good
Henderson?
with, yeah, that sounds
Greg, okay,
great.
good.
Okay, so 15,700 was your official ask, and we are happy
please.
to oblige with that.
Thank you so much.
Okay, so now we have environmental health refunds. Apparently, Eric and Tom, are you available? There's somebody's cute dog. Who's that?
That's Candy's cute dog.
Oh, Candy's cute dog. Okay, very cute.
That's Trip. She's very
It
happy
was
to meet you.
dog day the other day. Okay, I see you, Eric.
Good morning.
Hi, good morning. Well, it's afternoon now.
Oh, yeah, sorry.
That's okay.
Good afternoon.
So on our spreadsheet, it says 750,000. You gave us a great kind of or maybe Greg did, with the line items of the environmental health kind of annual budget, I think is that what that is, which adds up to definitely more, closer to 1.1 million. And the request might be, can we dial it back from 750 so we can do other things for youth? I don't know if that's the official request, but that's one of the items, yeah.
Do you have any kind of a percentage on restaurants that have actually had to close in the county at this point in time? Do we know the number? Has it been 10%, 20%?
We don't have a number on that, Commissioner Adair. A lot of them have been affected by opening only 1 or 2 or 3 days a week. So when we do go there, and there's over 1,000 mobile food units and restaurants that we license. And so it's been really hard when we go out in the field to do an inspection. They're closed. So we think they're closed, but then they're just closed for a few days. So we don't have any good numbers on that at this point in time. And so I just wanted to also share that we have Tom Kuhn is on the phone, public health manager. And is there any way we could share a screen just real quick to show
Yes,
that
of course.
that we also license
I know pools, hotels.
hotels and motels and 277 pools and spas. And so those are the licenses. Those are specifically the license fees that total $975,000. So I just wanted to share. Those are the licensing fees. So it's restaurants, which includes the food trucks, like I said. Also the temporary restaurants, like for fairs and festivals. And these are fiscal year 20 fee revenue numbers for environmental health licensing fees. And so there obviously are some pools and spas and some hotels and motels that have been severely impacted by COVID and the shutdowns. And so I just wanted to kind of give a more introspective or more thorough, robust look at the number of licenses. And so it totals $975,000. So that's just up for consideration by the board. And if it's a percentage of that, we could really quickly calculate what that would be if it's 60 or 80% of those fees. So I just wanted to share those numbers as well for the board.
So Eric, we've got those in a support sheet behind our green pages. You probably, I see Tony has it. Do you have it, Patty? It's back behind the greens. Yeah. So I guess that's great. You presented that, because what our question had been has everybody been affected equally? We're talking about giving back some of the environmental fees as one of the CARES Act ways to help industries that have specifically been hurt. And I was wondering, for instance, like you got 35,000 in this as other jurisdictions. So I'm assuming you're doing inspections outside Deschutes County. Is that an example?
No, the Commissioner Henderson, that line item is specifically for food handler card payments through a Lane County food handler program. So that is not a licensing fee. That's just revenue that we take in through a food handler coordinated program with Lane County Public Health.
So would we need to, would people have been, that fee pays for, would they have been affected by the COVID-19 pandemic, or are they immune to that, or what, how's that?
Well, that's just a $10 food handler card payment.
Okay.
And so
A lot of them, yeah.
the $35,000 basically represents 3,500 people who
Right.
paid $10 for a food handler card through an online food handler card program. So the ones we highlighted, those are specifically businesses that paid us a licensing fee for fiscal year 20. And so I just wanted to
Our
present
draft
that.
doesn't have the highlight, it's just a clear white page, it doesn't have the draft. So you're saying the yellows and the blues, or?
And that totals 950,000, Eric?
The highlighted, I'm hoping you can see that. Forgive me if you can't see the yellow highlighted areas.
Yeah, we can see it on
We
the
can
display.
see it on your screen,
Yep.
yes.
Hard to read the screen, so I'm looking at my paper, but okay. go
Oh.
ahead. So the yellows?
Yeah. Those total $975,000 for the licensing fees specifically.
So if we refunded them 60%, that would bring our cost down to 585,000, of which we would save 165,000 to put into the school program. That's at least returning 60%.
What is a tourist facility what's that category?
Hotels and motels, of which we license 87 in Deschutes County at this time.
Is that number in there too? Is that highlighted too?
Yeah, that's the 20.
Yeah, that's the EH tourist facility.
Okay, so that's 34,000. So could you tell me which one so I can mark it on my sheet, because I'm having a hard time reading that. So I know we have the pool and spas, 160,000 plus. The restaurant fee is 758,000. The tourist facility is 35,000. So what other ones are we thinking of refunding?
The other license category is environmental health temporary restaurant fees. That's $22,096.
Okay, gotcha.
What is that, temporary restaurant fees?
Those are the fees that we take in for food booths at Munch and Music, at Bite of Bend, at farmers markets, where we go out in the field and inspect food booths. So the fees are generated from those temporary restaurants at those events.
So those we gotten any of those this year, or?
Well, that's the money that was taken in for fiscal year 20. Essentially, that's about half of what we would normally do. That includes all of last summer and last fall. That number would have been a lot higher if it wasn't for the pandemic, in which basically hardly any events.
But those fees probably, they made money because they were during the event times. That would be one maybe we could drop.
That would be understandable.
Another question to me is tourist facilities. I don't know how much they've been hit by things. That it doesn't seem like as much as restaurants, because people are still coming here. I mean, I don't know.
What's tourist facility inspections?
Hotels and motels.
What I could share about that from firsthand experience and talking with some of the hotels and motels is earlier in the year, Stay Home, Save Lives.
Right.
Did
impacted them pretty heavily. And also the state Oregon Health Authority recommendation is that they do not clean a room for 24 hours after somebody has left. And that really limits the amount of capacity and volume vacancy that they can have for rooms being filled up. And so if you talk to that industry, they would talk about how they have been
Yeah.
pretty impacted by,
Very
by
much
the,
impacted, yep.
the pandemic.
But maybe not as much as the restaurants. I mean, in the sense that,
the
because there was that period, remember when we did the shutdown for the short-term rentals?
Right.
Turned out to be really a good period because there weren't very many rentals between April and May 15th. It was, we'd shut them, but it wasn't a high-demand period. Then as soon as
Yeah,
high
no,
demand
they all
came-
stayed in Bend. That's what happened.
Yeah. Well,
Remember,
maybe
Bend
they
got
did,
the
yeah.
revenue because we had the short-term shutdown.
What about the pool and spa fees? How many people does that, or are those motel pools, or, I don't even,
Spas, there's all kinds of spas everywhere.
like,
Yeah, the public pools and the public spas are at hotels and motels and resorts, Black Butte Ranch, Eagle Crest, Sun River. It totals 277 licenses for those pools and spas. And until we hit phase 2, they couldn't, of the reopening plan, they couldn't even operate. So,
what's that,
they would-
3 months?
They would probably talk about their
Yes.
impacts as well.
Until phase 2, which was what, June 6th, June 7th? So yes, they were definitely without revenue for a considerable period.
Yeah, that's a good point.
So
Well, I
I just think saving the 170,000, if we only refunded at least 60%, that then we can put it over to this.
And drop tip restaurant fees.
Right. The temporary restaurant fee is 22,000. So if everybody else was refunded 60%, Eric, could you give us that number?
Absolutely. If I was smart enough, I'd do it right now, but I could certainly get that.
We've got Greg, he should be smart
Greg,
enough.
can you give us that number? I didn't bring my $15 calculator today, so I really don't want to trust my phone. But I did it originally.
I just updated it on the spreadsheet without the temporary restaurants.
Okay.
So
So what,
60%?
so what is it, times 60 then?
572.
572. Okay, so-
572.
Okay, yeah, I done 585, so, okay, that makes perfect sense. So that's, we've saved money to put over into the kids.
Do you think the 60% for everybody is fair? I mean, we haven't spent a lot of time understanding all this.
Well, we know that the restaurant industry is one of the industries that has been, so it's a hard industry to make it, and.
I'm not,
and
I
it's-
know.
yeah,
But I'm
it's-
saying relative to each other. I'm not saying should we contribute to restaurants. I'm saying that we're giving everybody the same. Like, whereas in like Madras, I think they did return all the fees to the restaurants, but I don't know if they did with anything with pools or
Right.
tourist, I didn't ever hear that they did anything with pools, spas, or tourist facilities, so.
Well, I think we have.
I could
more
just
tools.
interject. I talked with Michael Baker, their public health director, and they did refund the pool, spa, and hotel, motel, tourist facility fees as well.
Oh, okay.
100%?
They did, and it probably should be pointed out that that was a total of $40,000 for.
Right. That's
different.
why-
Yeah, it's
That's why we're
different.
looking at,
Very
yes.
different.
Proportions are very different.
Yeah.
Well, it'll be a wonderful check in the mail or whatever, however it might work.
So we'd set up 750, which was just restaurants, but we've moved it to 670.
Estimate, yeah.
What'd we say?
572.
575 or something?
572 is what you said?
But we're doing 60% and we've put in pool and spa, and we've put in tourist facilities. So we've broadened it out, but we've reduced the percentage
Yes.
at this point.
So, I don't know if being fair is the right word, but at least it's refunding something back to the community that's really had a very impactful time in 2020, and I'm sure they can't wait for 2021.
So there's quite Eric, there's quite a range of the size of what these checks would be, isn't there? 60% of different, I mean, we don't need to go through it right now, but it seems like it's, when we do our fees, it's quite varied.
Well, yeah, and it's based on the amount of indoor seats, for example, for restaurants. The bigger the restaurant, the longer the inspection takes. So the fee is proportional to the amount of time it takes to do a bigger restaurant. But I think that 60% it's just a great recognition of supporting the businesses who've been so impacted. It would take so much legwork to try to really quantify who's been more impacted. The model of a drive-in restaurant wasn't as impacted as much as a coffee shop, for example. But I think just doing it across the board is the fastest, most efficient, and truly the fairest way to do it. So I just think it's great that the board has undertaken looking at this, and I really appreciate it. And the businesses will too. We'll get a lot of great feedback in the field from this. I know it.
Mm-hmm.
Well, especially because you've taken a lot of, you've stepped into delicate situations on many cases with, education, enforcement, et cetera. And so maybe this will help soften that, all the work that you've done. You've definitely been great, county health partners. So we thank you for that. And I know it's been a 24/7 job.
Yeah.
So what I would propose then is
just trying to help these folks out, try to navigate through all the guidelines and what they're supposed to do with foodborne illness protection, and now what do they do if they have a cook with a COVID case. We're doing a lot of legwork and education there and just trying to help them out as best we can.
I know, because you keep hearing about every once in a while a restaurant had a positive, so then they shut the restaurant down for a week. So that means, all those workers aren't working. The restaurant isn't making any money. It's been really difficult for them.
So what I would propose is, so that would put 178,000 more
and if
into the 200, and then if we took 100,000 out of the business support grants for now, I don't think and maybe we aren't going to resolve the business support grants today because we're going to wait and see what the Business Oregon grants are, but we still have that money there, and then take out 100,000 out of the county facilities, maybe.
Yeah, that's great.
Now, and we'd be.
And then if you take 62,000 out of the Williamson building lease, which really we're going to pay that one way or another, and we can actually get reimbursed for it.
Well, we're at 578 if we do the 178 and 200, or 100 and 100. That's 578.
Well, she's asking for 650.
And then there's kind of the big picture of finalizing this spreadsheet, sending everybody off to do good things with these dollars. And then, as I say, 2 or 3 months from now, as I say, would we hold on to this spreadsheet for 3 months, or would we finalize this and then just bring an analysis back 2 months from now?
No, we need to look at it. We have to look at it every month at least. I mean, this is really critical because remember, these dollars have to be spent prior to year end. So
well, I think
we've got
what
to
he's
stay on top
saying
of
is,
it.
could we resolve it all today? I guess what I'd like to do is leave the 150 in business support to see what develops. So that's a little bit part of
Leaving
this
it in there or
spreadsheet.
distributing it to COIC?
I don't want to distribute, because they're actually having to use our personnel to do the grant program they're doing now. Let's just wait a bit, because I think that COIC is going to get a big allocation from that Business Oregon thing. So maybe we just hold it to see if there's some other business option that comes up, thing we could contribute to there. That'd be my thought, is we just don't deal with that today. And I don't know if we choose in item D, if we're going to reduce from 200 to 100, do we choose some of those today, or do we need further prioritization from the county staff as to which ones make the most sense? Or I haven't really thought about it.
If we take 100,000 out of the county, then we make the 640 if we do the lease in it. So that's right
Well, I'm not,
she's asking
I'm not
for.
really supportive of changing that lease number in there, just for accounting purposes. I don't see it as a fund to pull it back from.
Yes, but that building, we already were leasing that building, so they just happened to put the COVID people there. I mean, that building was already that was a lease signed before I took office.
Well, and I'm just thinking.
So that, that really could come over.
The accounting of it. So, our finance person is going to notify the health department that now you need to move it from one column to another, and it's like 3 levels of it. That's the reason I wouldn't want to change that right now, is just because of the changes in the process. And this is an assumption on my part. I don't know exactly how it's going to work. But changing it now just means that a bunch of people are going to have to react to that change. That's all I'm saying.
I don't think anybody's going to do anything. This lease was signed before I started, Tony, before I was elected. You guys leased a building for a whole bunch of money. I can't remember what the square footage cost, but it was excessive. And so it was already here, so it's already part of our capital, our cash requirements for running the county. So, I mean, if we can help the kids and get to 640, I think it makes sense.
Commissioners, I just want to clarify something real quick here. So we have about 2.1 million that's uncommitted at this point. That's the amount that's in the estimated amount of pool that's left in the coronavirus fund. The list that you're looking at, the original list that's not highlighted in green, all of those numbers for broadband, hotspots, all the way through columns C and D, totals 1.7, almost 1.8. So we're still about $300,000 short of fully allocating.
We've got more money than we've spent so far, is what you're saying?
You've got more available, yes.
Oh,
So I would just let you know that. The other thing I would say is that this is something we can bring back weekly as new information comes up, new requests come in. Some of these dollars that you've allocated are not going to get spent, and there's going to be other requests that come in. So it's something we could kind of stay on top of on a weekly basis or even more frequently.
Don't you think we need to weekly, Greg? I just feel it's really important.
I think so. I think so because right now we're dealing with a December 30th date, and we want to make sure that we maximize our use of funds. And the information could be coming in weekly. I can give you an update on that, and if there's new requests that come in, you can change that allocation on a weekly basis.
Yeah, because, I mean, I'm just as supportive of taking something. It sounds like we don't have to. We could actually we could do those reductions, put them into the Better Together program, we'd be at 578. So it sounds like we get the other 100 or 68 or 62, 72, whatever it is. 72, isn't it? Yeah, 72 more would get us to 650. That way we'd still have that. But I'm as open to taking money out of the EOC allocation as the lease. I mean, it's both of those, like you said, are kind of our expenses. But the issue to me is how much of the 6 goes just to pay for county expenses versus how much goes to pay for the whole county, the people, the businesses and the needs of the county generally. So.
Well, EOC is definitely pandemic, that 500,000. That is definitely a pandemic cost.
I don't know if we're spending that much.
Right. I would think
We've
that would
already
be
given-
more generous than we have to spend.
Yeah, I don't know. I don't know how much we've spent. We've already done 1 or 2 requests for EOC, right?
3. We just did our 3rd one.
Oh, and this is the 4th?
Uh-huh.
No, it's actually for the rest of the year.
Right. This is for the rest of the year.
So we've done 3 already. And how much did they total?
The last one was pretty minimal, wasn't it, Greg?
It was
The 3rd request was 308,000.
Right.
$1.7 million, $1.8 million total.
$1.8 million.
Right.
Is what we've asked so far.
Reimbursement.
And how much of it was EOC?
Well, about $1.2 million, I want to say, Greg, because we did get the last rounds of business assistance transfers were part of the second reimbursement request.
Yeah, that sounds about right.
Well, I'd propose to wrap this up today by this authorization, the 400,000 for neighbor impact, 650 for the Better Together, the 60% allotment for environmental health fees that, as we discussed, which totaled
that's
about
five-
572 is what
Right.
Accountant Adair referred to. And then I'm in favor of the SBDC capital formation. I think that's exactly what that entity is supposed to be used for, is helping businesses. And I like and then we leave 150 in the business support grants, but don't allocate today. And then we put 15.7 into Deschutes County 4-H today. And maybe we come back next week with the county facilities and say if we're going to only use a half of that, which we allocate the half to.
Well, I would support proceeding basically and giving us a weekly update, as in if we're going to do courtroom upgrades for circuit court at the Fair and Expo, just go do it and, start rolling up the numbers. So, keep a good eye on it, but start spending some money there. I don't know that we would want to stop spending money there.
Greg, can you give me a total of that, of what Commissioner Henderson just said?
Yeah, I'm running that. Was there conversation on the hotspots?
No, we didn't add those.
Okay. And
We haven't gotten down there to those details yet.
150,000 for the business support. Is that correct?
Yes.
Okay, and then I still have 200,000 for county facilities, 15,700 for OSU. That puts us right about just a little $62,000 under a $2.1 million limit. So that's $2,037,700.
Well, I recommend cutting the county facilities to 100,000 because we may have other needs pop up here that would be more pressing to the people and our business. I mean, these are things we can attribute to COVID, but we don't necessarily need the CARES Act money to do it. So I guess I'd rather.
Okay, that puts 1,937,700 with an approximate surplus of 162,300.
That is unallocated
Unallocated.
at this point. Okay, that's good. So we have a couple categories to still work with, and okay, I like that. That's my proposal.
And I would, just for clarity, for county facilities, if we're saying 100, which is fine, that there's no reason to stand by for anything, as in go start projects or plan projects, spend up to that 100, and we'll go to more if needed or whatever. Just giving guidance for the property facilities department.
And that is leaving the 150 in business support grants?
Correct.
I did hear about a county who had given, I believe, $1 million in support grants. And, I hope that more state funding comes through for that, because I do know our community could use it.
Yeah. Well, we've given, I can't remember when people ask me, there's been, 2 or 3 different things we've done.
Right.
And this would
We've
be
done
another
grants
150.
and loans.
Yeah. And then we've done child care specific. I mean, but I'm in favor of that too. I mean, there may be opportunity, maybe the other 160 goes back into businesses. What's unclear to me is what, having worked with this Business Oregon stuff, how to really get it out to people affected. It's kind of random who applies and who doesn't.
When I worry, what's a meaningful amount for a small business?
Yeah.
$1,000 may pay off some part of a rent or utilities, but then they really didn't get ahead somewhere else, or inventory. So, it's kind of awkward amounts that people might be receiving.
Yeah, it's really a big philosophical question.
So since this is a 12-week proposal by Better Together, so does that mean that if the program only has to go for 8 weeks and our schools are back in session, is it pro rata, or will our money be the first to be used? Is it first in, first out? How will that funding work, Greg? Do you have any insight into that?
So I don't specifically, but I would say it's probably on a case-by-case basis. In other words, with the environmental health licensing fees, those are dollars that we would send immediately,
Right.
or as immediately as we could. And others, we would base them on invoices. So we'd have a contract and we would be invoiced for these costs as we move forward. As, for example, with Better Together, you know, what Becca was talking about is the future is uncertain. This would buy a certain amount of capacity, but they may find out that they don't need that much capacity. Therefore, we'd be able to return those dollars and repurpose them elsewhere. So I think that's what's important about coming back on a weekly basis, is just to give you an update on where all of these are, because they're all different.
We're kind of doing to them what the state did to us, getting reimbursed. So yes, I think it's really important to do a weekly update. I think it's critical. We're talking about, you know, public funding, and
Yep.
we must, you know, very carefully watch our dollars and make sure that they're being spent. And yes, and I hope those checks can go out as soon as possible. Just, you know, kind of a September surprise.
Absolutely.
Thank you so much, Greg.
Commissioners, were you interested in revisiting the testing amount based on our conversation from earlier today, to potentially increasing that from a total of 200,000 to either 250 or 257?
An extra 50,000.
I think I'd be more inclined to just reduce the 200 to 150 now and see how it all works. Get some reports on how many they're testing and how it's going. That'd be my inclination right now. It's a little bit
That gives clarity for today. And
Today.
it gives us a runway. 150 is going to be a program, 50 more in the future possibly with justifications.
Right.
I like that.
Yep, I think that makes perfect sense. So do we need a motion, Tom?
Yeah, the 150 would still be in your authority realm, so, and Dave, I don't know if you're still on the line, if the proper motion would be for the board to approve a contract or a grant agreement, I guess, in the amount of 150 even to Mosaic for that agreement.
Right, and that's within your contract authority. You're 150 and below, the board's above.
Oh, there's the number.
Right. Well, if you're giving direction to me to
There you
sign it
go.
for that amount,
We're giving direction to
then
you.
I'm happy to do that.
But we would like a report on how many people they're actually testing, if that's at all
Sure.
possible.
Sure.
We would really, you know, been talking about testing for 5 months plus, so I really would love to know what's happening.
Okay.
So I noticed on our agenda, we are supposed to have a lunch recess and reconvene at 1. So could we reconvene then at 1:50? 1:30?
130.
Okay, we're going to adjourn now, Stephanie, and we will reconvene then at 1:30, if that's okay with everyone.
I did have one other quick point on
Oh, yes.
COVID. So it sounds like you've made some great decisions today and are close to at least the latest draft of an allocation. So Whitney has prepared sort of a generic press release where, if at your direction, we can make some public statements about what we've done in terms of allocating our CARES Act money towards these various causes. And with the discussion today, we can incorporate that and share with you a draft for you to take a look at and make sure it kind of fits with your vision of our, public statement on what we've done there. And we can bring that back either
This afternoon, or is that too soon?
well, if Whitney's on the line, she's awfully quick. We can try and bring it back later this afternoon.
Okay.
Otherwise, she'd just share a draft that you can tinker with and give her feedback, and then just give us direction to send. So
Maybe
Great.
good to get out today or tomorrow, so it's news of the week before.
Appropriated, or we've allocated, 90% of our CARES Act in the following ways or something.
Yes, the good news is we didn't allocate 100%. We were conservative and allocated 90%, so, yes.
Yeah, I think it'd be good to get out.
Oh, yeah.
There's a huge
Exciting.
political message about if we'd get the same amount of money as Washington County had got, we would have been allocating 30 million or 35 million instead of 6.
Gosh,
People don't realize how, when we're talking to the Better Together, it would have been easy if we'd had the kinds of money that's Multnomah
And
and
don't-
Washington County had. And
So there's no function of efficiency with more people dedicated to a smaller footprint area, or, you know, I'm thinking from the federal level, they're making those direct allocations and then leaving rural at 30 cents on the dollar or whatever the proportion is.
Oh, it was even less.
Yeah.
And don't forget, they're still sending money to Washington and Multnomah for their schools, even though they got buckets of money. So, yeah, it's really gotten extremely
well,
unfair.
I've seen Washington County's allotments, you know, and it's millions in these categories that we're talking about, hundreds of thousands.
Yes, and here we are,
Big chunks of money that they.
trying to be very
We can make a
frugal.
press release down those lines. Or
Like,
Good luck,
no, I
Whitney.
don't know about that. I
Yeah.
mean, that should be in the press release, that
Yeah.
use their limited cares funds.
And don't forget, we still have to buy PP&E,
Yeah,
because who can count that it will be here? So anyway, okay, we're going to adjourn now. 1:30 we'll reconvene our afternoon session. Thank you, and Ed Keith, I hope you don't mind. Thank you very much. We convene our Deschutes County Board of Commissioners meeting this afternoon. And I believe the item on our agenda is consideration of the East Side Screens comment letter. Mr. Keith, would you like to join us?
There he is.
Good afternoon, Commissioners. For the record, Ed Keith, County Forester. I have prepared a draft letter for your comments and edits in relation to the topic that we discussed last week with the Forest Service in regards to their proposal to change what are called the east side screens, or this particular component within the east side screens that looks at the current requirement to not cut any trees over 21 inches, and their preferred alternative that is proposing that they switch that to a guideline, and that forests would then be allowed to consider cutting some trees of certain species over the 21 inches. So that's mostly the white fir, grand fir, Douglas fir over 21 inches. And I would just say, yeah, they reiterated with us that it's still going to be their goal to try to retain and recruit larger trees, but they feel this preferred alternative is a better way to move forward in promotion and retaining trees across central and eastern Oregon, due to the fact that they've actually seen a decline in those trees in the 25 years this requirement's been in effect, due to losses from insect and disease, fire, and drought and things like that. So I'd welcome any comments or suggestions for changes or additions to the letter that you have in front of you.
Thank you, Ed, for doing this. I think it's really important, and so glad that we are addressing the issue, what's happened to our forests. So if it's a 30-inch tree, how old of a tree would that be? Do you have any idea if it's a white fir?
It really depends on the particular site the tree is located in. If it's in a fairly wet site, it could be relatively young. The idea with that is any tree then between 21 inches and 30 that's still below 150 years of age would be allowed to be cut in order to try to maintain a healthy level of stocking in that particular area. So I would guess that a lot of trees would be somewhere between 80 and 150 years that would fit in that category.
So is this to help the ponderosa pine then?
Correct. It's to favor the more fire tolerant trees, and with the realization that some of these restoration projects that they've actually have planned, even if you cut all the trees up to 21 inches, still have a stocking level that's not healthy for the long-term maintenance or growth of that stand. It's either overstocked and is going to be subject to insect and disease attacks, or is so overstocked that should a fire burn through there, it's probably going to burn at a high enough intensity to kill the larger, older ponderosa pine.
Is the 150-year part of this an assumption then about the age related to the inches of diameter, or is it like two different tests?
My understanding, it would be two different tests.
Will they do a core sample to see if it's 151 and not 144?
Yeah, you could do a core sample, or in a lot of projects I've been familiar with, there's actually quite a correlation between different characteristics a particular tree would have. So the size of plates on the bark, the size of limbs, those sorts of things. There's actually a few different guides where people have gone and cored a substantial number of trees and then come up with a correlation of other physical attributes that are kind of easy to pick up that might show that a tree that's very large is young and it's grown that large because of good growing conditions, or vice versa, a tree that may not be very large but exhibits certain characteristics like large branches or different bark characteristics that would indicate that it's older.
So I like overall the idea of doing a support letter. I have some wording questions or changes suggested. I do notice there's not really any emphasis that, well, gosh, we're talking about 11 million acres of land here in this east side screen, and it would be good for the economy. I don't mind taking a position that there's an economic advantage to helping sustain our timber industry, et cetera, by being able to harvest some of these bigger ones as well. I mean, it's okay with me that we're doing some of this because it's practical, not just environmental. I mean, from an economic standpoint. So I don't know if the other commissioners want to add something there, but I think it's a real difference in philosophy. I mean, we're seeing lumber prices now have doubled. They're up at $800, a big article in the Bulletin this week, and yet we have these massive forests in Oregon that we're basically prohibited from cutting. So I don't know.
Something about added benefit of traditional lumber industry in Oregon or something?
Yeah, something about a sentence about that somewhere. Be
That's
good.
fine. So, I mean, the only thought is not to, kind of use trigger terminology to make it sound like we're, pushing too hard. Because it's always a balance right now, the collaborative, and you're on that collaborative, but, just the wording. I'm just sensitive to the words.
Yeah, and we had quite a debate at the collaborative level about whether we would take a position on it, and it really split between those.
We didn't.
And we didn't because it was so split between those that were just hard and fast on the 21 inches, and so maybe we could come up with a sentence. I don't really have one off the top of my head, but I would like that.
I tried to capture that a little bit, but certainly could add to it. In the last sentence of the second paragraph, just the idea that that this could be a win-win to help maintain our healthy forest while also supporting rural economies. But if you want to be more explicit or add to that
natural resource economies, not just rural, but natural resource.
Sure.
Yeah, I'm supportive.
And I'm definitely supportive. I grew up out of Heppner, and we used to have the Kinzu mill.
Did they have a sawmill that came out of there or something?
Yeah, exactly. So you know what? Yes. And there was a sawmill on my grandparents' ranch, and that's now down at the high desert.
Here we go.
Yeah, it's in my genes. So to help, keep our forests healthy. So why would we want them to burn up? Let's do things a little smarter.
The second sentence of that second paragraph, where it says it's clear that protecting these trees with the current approach is not working, maybe is not optimal, is my thought here, because working and not working is what it is, but something about
I like
not
the word
optimal.
optimal.
Yeah.
I thought we should add the word in the paragraph before that where it says it could be truly be a win-win. I'd like to add the word vital and win-win because I think it's important what we're doing. It's not just
So vital.
what an idea, just to add the word vital there. So optimal.
Okay.
Question I have about your last paragraph. So it only allows the cutting of white fir, grand fir, and Douglas fir over 21 inches? No. So all ponderosas stay there?
That's what's in their preferred alternative. That's the way it's written, correct?
That's even a less of a deal than it would. Personally, I wish we had something a little stronger about the fact that just because a tree is old or large doesn't mean it's sacred or precious. Because I don't know. I come from a pioneer family, not a new to Oregon family, and I just can't imagine seeing every tree as this monument to. It's just a crazy idea in my head, in my experience. I mean, entire parts of our state were built out of forests. That's what a lot of the agriculture was built out of, was trees were cleared, and then there was the industry built out of it. And this idea that because it's this big, it has to be there forever until it dies and clutters up everything.
Till it dies, and then it gets hit by lightning, and then causes a massive fire.
But I don't know if you would, if there'd be any support
Get that sentiment
here
in a few paragraphs. Yeah.
for some idea that just size or age does not make every tree precious. I mean, it's.
Well, this is commenting and showing support to a Forest Service effort. I mean, maybe there's another whole effort of timber industry that the Board of Commissioners could do. I'm not going down that path here, just path with you at this time. I understand your comments and I support that. The fact that, a good mix of trees and healthy forest, open understory, fire resilient. I mean, there's a lot of values.
I actually would like, I would bolden the word active management on here, just to add attention to a couple of the words that we've, and maybe the word optimal if it fits. I mean, these are really important things and isn't it amazing that it took 25 years, but we're now, addressing this issue. So it's good.
So do you want to make an effort about an added benefit is the ability for the harvesting or cutting of, reasonable sized trees for the maintaining the industry, or I don't know what the wording is and I don't know where it fits, but then bring it back to us or send it out to us independently and we can weigh in the next couple days.
Yes, I think it's due on the, 11th?
September 10th.
Oh, 10th, the 10th, yes. So,
We won't have a meeting.
so yes,
We
if
got
you
one
could
next
just
Friday.
take all these comments, maybe make it a little stronger, a little bolder, and then we can get it and sign it. That would be a really good plan. So we can get it to them early, so it doesn't get to the bottom of a pile. We're at the top.
Okay. I will make those changes.
Thank you, Ed. Thank you so much for doing this.
So then I'll move approval with edits or.
Eventual edits.
If this
Yes.
is our board meeting. So I'll move approval of letter of support for East Side Screens plan amendment in support with proposed edits.
And is there a second?
Yeah, I'll second that.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So thank you, Ed.
Thank you.
Now you're on the agenda again. Item
Okay.
number 8. It's your lucky day.
All right, thank you. So this item is related to Taylor grazing funds. You may recall from last year when we also funded a project. The county receives a payment from the state of Oregon related to Taylor grazing fees. And those fees are held by the county until such time as we fund projects specifically related to rangeland improvement. Rangeland improvement projects are, as described in state statute, relatively broad, or can be broad in scope, and can be anything from fencing, water improvement, noxious weed management, basically anything that kind of enhances grazing, for which the purpose of the fees were collected. The statute does say that the county's Taylor Grazing Committee should approve any projects before funds are expended. Since we don't have a Taylor Grazing Committee, we've used the Board of County Commissioners to act as the Taylor Grazing Committee to approve any projects before we fund those. We did advertise, like we did last year, for projects through media releases and direct contacts with partners, and received one project that you have in front of you. Generally, it's a project that's out on the eastern part of the county, in the Brothers area, on a particular spot of land where the project applicant, who's the East Cascades Audubon Society, is proposing to do a project that both could potentially enhance grazing and is a known habitat for sage grouse. So it would be to the benefit of this particular property, but also proposes to study some management treatments that might potentially be replicated in other areas as well, for the benefit of both grazing management and sage grouse. And I would just mention that I believe that the future of cattle grazing, particularly on public lands, is directly tied to the fate of the sage grouse, in that sage grouse has been in decline for a number of years, and has been kept off the endangered species list to date, which is good. Projects that can enhance the habitat or maintain the habitat of sage grouse are going to be important to being able to continue grazing on a lot of lands in the west and in Deschutes County. So there is a little bit of an important intersection with this project, and just the greater ability to continue to graze. So with that, I take any questions or comments on the particular project or the process for allocating funds.
Can you explain what a forb is? No, I'm joking. So it looks like it's just small plants that they eat as they're sprouting.
Yeah, that's small, broadleaf. So it's not a grass, it's not a shrub.
Pheasants too.
So like
Like forbs.
There you go. So I think Dr. Garrett was a name I recognize from the original committee for naming the Newberry Monument, in fact, back in the day. So I have talked to him in the past. I think he's been involved a little bit over the years. So it's interesting to see his name pop up. And this is it's kind of like a research project. And these dollars are basically going for the fencing and other supplies, other costs. Correct?
Yeah. The research portion would be conducted over a period of years, but this would, set up the property. And a lot of it would be for fencing to better manage the cattle on the property, as well as a little bit of weed control, and then a little bit of vegetation manipulation, so that they can study the effects of potentially reducing the shrub cover and how that might benefit both the forage production as well as the grouse habitat.
And that may be the big, the big theory, reducing sagebrush in an area to see if that helps them thrive.
That's what it says. Yeah. It's drowning out all the other things. If you don't have insects, you don't have chicks. If you don't have chicks, you don't have adults. Was this the only applicant for this funding this year? Or?
It was the only one, yes.
And do we know the actual site of this? It's not in a place we're looking at putting it in landfill or anything, is it?
No, this is a private parcel, just north of Brothers.
North of Brothers.
It's already under,
It's a big parcel, 320 acres. It's half a section.
well, I'm supportive. It's great to have, a project of this magnitude that could have some real effects in grazing in the whole western United States, basically.
Yeah, I like the idea. I'm interested to see what they come up with. Dr. Garrett's also been involved in a lot of natural desert stuff, other kinds of species, really like you'd mentioned, but for several, decades, really.
Yeah. Is there any other connections back to your work, Ed, or, like an update a year or two from now? Would there be any natural time that we would hear about this again?
Yeah, we could certainly bring this back. I think that, most of the activities that would be funded would be complete by either late spring or early summer of next year. And we could, ask to, for a end of project report of what got completed, at least at the end of the year. I did that with the last project. The last project was a little bit, I guess I would say, a little bit simpler. It also involved less funding, but was a 2-mile fencing project closer to the Hampton area that allowed that particular landowner to divide a very large pasture that they had seen a decline in productivity because they weren't able to manage their cows just because of the immense size of the pasture. They were back when that pasture was able to support. It took about 10 acres to support a cow and calf for a month, and the decline in production there had required that they reduce their grazing because they needed about 100 acres per cow and calf per month. And so the idea with that one was to break up that pasture and better manage their forage. And I did get a report back on that. So I would expect we do the same with this project, is ask for a written project report upon completion.
How about a year from now is fine. So with that, I'll move approval of Taylor Grazing funding for the proposed project.
I'll second it.
Any further discussion? Commissioner DeBonne?
Yes.
Mr. Henderson?
Yes.
Yes, and the chair does vote yes. Thank you, Ed. It will be interesting to see, reading that the problem is getting worse instead of better. What is the answer? So I know I've heard from people that juniper trees have taken over Central Oregon, and I know they suck up a lot of water. And what did the county really look like 50 years ago? How many juniper trees were here then? So that's what I hear from long-term residents.
So I hunted in Eastern Oregon 50 years ago, and there was a lot less juniper trees in general. This is about sage being overgrown too, but
right, I know. I mean, it's a change.
Yeah, it's a whole other deal.
Change.
But yeah, the juniper is way less common than it is today. There's lots of young juniper. The other thing, though, is with something like this, that there's other things that affect wild, species. I mean, even like other bird populations fluctuate hugely in Eastern Oregon, the chukars and some of the other wild birds like that. So, I mean, with weather conditions and really awful winters will completely wipe out a population. So it's interesting to see what they learn about specific in one spot.
Great, thank you.
Thank you.
Thank you, Ed. Thank you for your flexibility today.
Absolutely.
All right, so other items, I believe that are we going to talk about the veterans our mission yesterday, or are we going to wait for a minute?
That would be under executive session.
Okay.
We're going to ask for direction on the land, but, and we also have the staff that accompanied you on the tour yesterday is on standby to be part of that discussion.
Okay, for executive, all right.
I had some other items.
Okay.
So I think, Tom, I haven't really seen you since the week before last. I had a question on the fair dinner, a couple questions. One was food given to all the rodeo and fair association people also? So they had it. I didn't notice it, but I was concerned that they weren't getting fed while the rest of us were. It would have been nice if they had tables also or something, so they're treated kind of similarly, but I felt there was kind of a sense of unequality, and I would have liked to have had them feel involved as much as possible. So that was the thing. I was curious also with the setup of the fair dinner that I thought David did a great job with his audit of everything, but his assumption that we had agreed to spend more money for that fair, it was built into his analysis, and it was like, and I, as I mentioned at the dinner, but I wanted to bring up again when it was just us, was it your understanding that there was some decision made to spend more money for that fair? I mean, I said I didn't think so, but.
There was a little bit that was built into the FY20 budget that was approved a year and a half ago for, I think there was acknowledgement of the entertainment was going to be a little bit more money. There may have been one other thing. It was a small amount. It wasn't a large, excessive amount, but there was.
It wasn't over 100,000 more.
No.
Which is what it ended up being, yeah. Anything else?
Related to increasing the budget?
Yeah.
There may have been one other item or two, I don't recall. I know entertainment was one, but it wasn't in a six-figure increase. It was what I would consider a modest increase, just again in recognition of the special nature of the anniversary fair. But the sum total of all of the adjustments in the annual fair budget, which was approved as part of our normal budget process a year and a half ago, wasn't, I don't recall, more than 100,000 in aggregate. So it was something, I think, less than that. But there was some acknowledgement in the last year's budget.
Well, I mean, I was there. I mean, I'm on the budget.
Sure.
I don't remember specifically. So you think there were some? Okay, and then I thought David did a great job with just all the different issues he explored and the thoroughness. I do hope he finishes up with a few of those things that he said he couldn't get the papers or something, or didn't see the contracts. I think we have a right to get those and get them from the other end if we can't get them from our end. So, and then maybe I'd like to have a review of that as the board, not in a big group meeting, but where we can look through some of that specifically, because it was presented to a large group in 15 minutes, and there's some drilling down I'd like to do that relates to other decisions. So that's my first topic.
It'll probably be on the audit committee agenda this month,
On
the fair audit.
It will.
Yes.
will be
So
on
you might,
our committee.
yes, so you might want to attend that meeting, which.
Well, I don't think I should. I will or could, but I don't think I have to,
No.
because we could do it here.
Right.
As the board, and they didn't drive that whole process. We did. We were the ones that asked for all that.
I know.
And so I want to finish it in a thorough way. So I just want to make sure we get another shot at it, not at a dinner meeting with, 50 people, but where we can talk about some of the specifics, because it relates to the future, I think. And then there was some big issues with accounting that Greg had brought up. But one of the things I'd never heard before, but it makes sense to me, that if they had set money apart or aside prior to the fair that they spent in the 100-year fair year, it would show as more expensive than the revenue than what had been predicted, because, and that was it was said at the meeting. I don't know how accurate it was, but I'd never heard that in all our meetings. I've never heard, well, one reason expenses were up was because we'd set money aside and because it was spent in that period. And I don't know how true that is, how much true, how true, whether it's true and how true that is. I'd like to hear more about that from Greg and whoever that knows that detail. But that was an interesting light on that issue.
Well, I mean, the budget is the budget for the department and for the fair, so that nobody can just add money that's been saved to their.
Well, we heard several fair board members say that money had been set aside for that fair in previous budgets, but then it got spent in that fiscal year, and so it looked like the expenses had been kind of out of control or something, and our net was less because I just want to understand I understand what they're saying. I don't know how accurate it is or whatever. It was just a follow-up from that meeting, I thought. Maybe Greg can help us figure that out. But
And my question would be about that is, what is the actual rodeo budget for 2021? In those numbers that we saw, we still didn't, I asked Gladys, we didn't really see the rodeo numbers, and so I just
in the budget or in the audit?
Well, in the budget, of all those pages of financials, where is the rodeo budget so that it's clear to Gladys? Because I looked and I didn't see the breakdown, and so I just think, and she's not sure either.
That's a good point.
Well, there is no rodeo budget for FY21 because the next fair, the calendar 2021 fair, will be in the FY22 budget.
But will it not start? When does it start, though?
Well, and that was one of David's findings, which was great in differentiating between the fiscal year and the calendar year.
Yes.
For a fair year, so you can keep all the expenses and revenues for a fair together, and that's something that we'll work on as one of the recommendations.
Well, you can see how sponsorship will happen 3 and 4 months before sometimes, and the money will come in, and then it switches right over to the fiscal year.
Just tying expenses and revenues to a fair rather than having them split up arbitrarily by the fiscal year is one recommendation. But on your point exactly, which is an excellent point from Gladys and from you, is that there needs to be clarity on what the budget is for each fair category heading in well in advance of the fair, so people can plan. But that's tied in with this notion of an agreement, that specifies how the Fair Association works with the Fair Board and also the Board of Commissioners to establish those protocols, those routines that both sides agree to. And since we don't have an active agreement, I think that was one of the recommendations from David's audit, and also a commitment from the Fair Board to reinstitute that kind of a relationship, a formal relationship between the Fair Board and the Fair Association on how the fair is to operate. Use of the facilities, the establishment of budgets, process for deviating from that and so forth, all the the mechanical pieces.
Well, and so that would be another thing for a meeting of ours. What do we want in an agreement between the Fair Board and the Fair Association? Because what I read in David's audit was that, well, there's been one, but it's so out of date because so many things have changed, we don't have one that's current. Well, I'd like to study what's that mean it's out of date, or what part isn't working. We really didn't get down into that detail of what we need in terms of agreement. But I don't really want to, sometimes I sense there's a desire to diminish the role of the Fair and Rodeo Association. I think that single event is very valuable, and so it's important we have them, and it takes a lot of people, and it wouldn't go well that we didn't have that association, so I want to make sure they're treated well also. So we have quite a bit then to talk about, all of these recommendations and where do we go with them. So I guess that's my other item, is getting it on an agenda where we can look at it beyond the a kind of formal dinner meeting, public deal of it. Another thing on my list, I had a call from somebody yesterday or day before yesterday, I can't remember which, about Maxwell Bridge having a similar problem kind of to Harper Bridge,
Right.
the traffic and the people over usage, et cetera. And request was made to, if nothing else, at least put something to slow down traffic over this coming Labor Day weekend. And I talked to Chris Doty, and he thinks that's possible to do. So I was going to try to get on the agenda today, but it sounds like we don't really have to do much. But I don't know if either of you have heard about that as being a
I
growing.
read the letter, yes.
The letter from.
Yes, the people that live in that neighborhood sent a letter copy to
Oh,
all
okay.
of us. And yes, they did want to, and if Chris can do that, I think that's.
He said he thought he could because
Yes.
you've got new equipment or something, new road sign.
Yeah, it'd be those temporary reduction.
Temporary.
He has the authority to do, and kind of the reader boards that congestion ahead, reduce speed limit, those sorts of things.
Yeah, okay. So he said he could.
That's
do it.
actually the Forest Service facility at Big River is the launching point there, which is the next one upstream.
Yeah,
public launch
yeah.
From Harper Bridge. And unlike Harper Bridge, that one does have land capacity, but it's a federal facility, not a county facility. But so that would take working with the Forest Service to be able to do some kind of permanent expansion. And as you and I learned from the Forest Service before, they are sensitive to river overuse and those sorts of things.
Yeah.
It is physically
possible
to expand the parking area there to get people off the road.
If we started this year, we might get it done by 2030.
Yes, we might.
So that would be every year we let go by is one more year. It doesn't get. That's good to know. Yeah, it'd be interesting to take a map of that and then go meet with the Forest Service, say we'd like to do that. Because I think encouraging more people to start there as opposed to on Harper Bridge, although they get out on Harper Bridge, so anyway.
Okay.
I have one other thing I'll wait for, but go ahead. You guys
One
have
more
other
thing?
things.
Okay. And then Tom Anderson did mention that the chamber wanted to do a county special on us, but they didn't have time to do that until December. And Commissioner DeBone and I both said we would like that done right away, as soon as possible.
This
So
was a
remember-
conversation right as you were walking in the door
Yes,
this morning before.
that was what you missed the first thing this.
Who wanted to do this?
So what it
Chamber,
is?
The Bend Chamber,
It's the State of the County address
yes.
as requested by the Bend Chamber of Commerce.
Oh.
He said, yeah, we need to bring this under other items.
Yeah, I just got a note from Katie yesterday. This is the one that's typically been done in July, but they postponed it because of the pandemic, and they've been featuring pandemic-related webinars for their businesses. So Katie would like to do it, but she says they are stacked up with programming until December. She gave me 2 dates in December, and I told her.
And that's what we reacted to. It's like, we should probably try to do it before that. So that's what we were talking about.
October would be a much
Yeah.
better month.
Better.
Yes,
Well, we could give our perspective on the pandemic. I mean, they get all the health experts and the
Yeah.
business experts. We know quite a bit about the whole thing. We
This
could
is a Bend Chamber request, and we've done it for Redmond and Sun River Lapine in the past.
Yeah.
So do we think of it as the Board of Commissioners State of the County address for the Bend Chamber, or the State of the County address?
Well, maybe we should offer it to Redmond and say we're
Yeah.
available in October.
There you go.
And we could let Lapine know that we're available in October for the State of the County COVID address.
Yeah, I mean, it'd be pretty interesting. I mean, we'd be COVID plus.
Yes. And Whitney, do you have something you'd like to add?
Welcome.
There's just for visibility, and I'm sure you know of this model through AOC and your correspondence with other commissioners, but in other counties will hold state of the county addresses just internally, and so that's a model that we could also pursue if you wanted to host an address that was just really more you hosting it and providing that opportunity to update residents on topics. So.
Just to kind of do it here, maybe video, the whole deal.
I mean, like our press conference we had
Yeah.
several months ago.
Potentially with some opportunities for resident engagement and the ability to ask questions, something
Yeah.
like that. So that's just something to think about. It's not a model that I'm aware that we've done in the past, but it's certainly something we could look at for this fall.
It'd be interesting. I mean, people probably
Well,
wonder what's, because it's been such a
That's-
different year. It'd be, is that why you're kind of promoting doing it before December?
well,
Well, there was another reason, but we won't tell you that.
the COVID updates on Facebook, I mean, there's numbers there that people aren't usually hearing what we're talking about.
Yeah, like the hospitalizations.
Yeah.
How
Right.
few of those are actually Deschutes
Deschutes
County
County.
residents, and
Yes.
So,
some of there'd be interesting things we could do.
and, stepping into the fall and this kids in school and what we just did, investing in the, support programs, there's just information that's not getting out as much these days.
So maybe just set up our own state of the county.
It's certainly something that we could explore if the board has an interest in that.
If the chamber is not willing to move it up to October.
Right.
You want to do that?
Well, yeah, for a Chamber of Commerce, it's usually an event where they can sell, $15 a head tickets and fill the room. So that's why they want to do that. It's a little bit of a fundraiser.
Phil, they're not fundraising anymore, though.
Well, yeah, so the dynamics are changed, exactly. But I'm just saying, that was their motivation.
It was more like $30 or $35 if
Oh,
you
what-
didn't, yes.
They can make X amount, whatever it is, yeah.
It was a profitable venue, which is fine. That's the good news about capitalism. So, yes.
We'd
I
have
think
a
we
lot
should
to
do
say.
something.
That'd be interesting.
Yes, good,
We've
okay.
done a lot this year. We've been involved in a lot.
So aim for
Aim for October,
first half of October or so.
yes.
Good.
Good idea.
And, yeah, in partnership with the chamber or possibly not.
Got it.
Commissioner DeBonne, did you have some other items?
Just we'll talk about the Veterans Village trip. I did go to Columbia County the night before. I did spend the night, met with Commissioner Tardif. So I see him, he's the treasurer of AOC, so I see him online. And we had talked a couple months ago just at AOC down in Salem, and I said, yeah, we should just get together sometime, just in passing. I do that with a lot of people. So this just fell into place, and I was able to do that. And a couple things, one of the things, a big takeaway, a lot of the timberlands are corporate owned, Weyerhaeuser corporate owned, and which kind of came and went in my head, but he was pointing out the fact that, that there's no revenue from that. About a half a dozen years ago, they closed it to public recreation, most lands, the corporate owned lands. There's 7-point-something% public lands in the county. So there's a lot of timber that comes out of Columbia, but not to the benefit of anybody but the corporate, which, is good that there's log supply, because we were just talking about how we don't have log supply because of federal policies. But that was kind of one of the big takeaways. I was like, oh, interesting. All these big green land, because they've got the coast, Scappoose, St. Helens, Columbia City, Vernonia is inland. But the rest is all timber. So just puts it in perspective.
But it also is so different than, so you go one county over to Tillamook and you're all state forests. And so there is benefit to the citizens from the state forest where they're harvesting, or somewhere like Hood River has county forests that supply basically a whole mill there in Hood River. But it's the federal forests that have really been shut down, and like you're saying, and there's no timber coming off any of it, really.
Dry side and wet side is very different too. So they manage for a 40 or 60-year rotation, where here it is more like 80 to 100 years.
Yeah.
For Ponderosa, we were talking about the other species earlier too. But yeah, so that was one of the big things. And 50,000 residents, the town's all kind of beautiful, quaint downtowns, but a lot of people live in rural. Scappoose is a commute into Portland for a lot of people. I for some reason, I never knew that until he said it, but when you drive it,
You realize
it's a commute shed. I didn't think of it I never thought of it as a commute. And he's like, oh yeah, a lot of people drive back into Portland from there.
So how long does it take?
Not very long. I mean, you pull up out of, it's Highway 30 from downtown Portland, and then it's a little industrial, and then all of a sudden you're just on the parallel road to the Columbia River the whole way up. So it's only like 20 miles or something. I'm sure it gets congested at different times. But yeah, so Scappoose was, I never thought of Scappoose as
That whole
a
area
suburb.
is kind of north of Washington.
Those are the things you learn.
Well, speaking of the trip to Portland, so what I did after yesterday, I went downtown Portland to take and got some pictures of the damage from all the riots and things, and it was interesting that it's pretty cleaned up now. That's one observation I had. Most of the buildings are boarded up on the first floor, some of them up to the second floors, which was interesting. A ton of graffiti, awful graffiti, a lot of it. It's one of the things you really notice is what really got attacked were government buildings. So it was the Mark Hatfield courthouse, but there's an old federal courthouse up there that has just covered with graffiti still. But the Multnomah County Courthouse was also had lots of stuff done to it, but then other places like the Apple store, the Nike store, lots of them have closed down now, and they're just covered with boards, but with all sorts of graffiti. I've got the pictures of the Apple store, which is, thought Apple might run ads. It's so creative. But anyway, but you really didn't see much. And I went with my sister-in-law or sister and brother-in-law, and they said a month ago it was much worse, the downtown than it is right now. But they've moved to different places, so they've gone to the North Precinct, and they've gone. There was some damage to the county building, the similar to our building, not the county courthouse, but the county building.
Administration.
Yeah, but very much seemed like it was targeting of government entities. So that was kind of interesting. Very few people downtown, and the businesses a lot of businesses seemed closed. So.
What time were you there?
I was there, right after lunch, so 2:30.
2:30? Because you can see pictures of New York City, and there's like nobody in New York City now. I mean,
it's kind of like that in downtown Portland. But it was just interesting to see, after watching on the news for 3 months, to go and see it. And then there's things like where the elk statue is taken down. Somebody's built up some kind of goofy elk statue, and there's all these things hanging from it, and just kind of interesting to see what goes on in our state. What's that?
I tried to connect with Commissioner Stegman from Multnomah County. Her and I had lunch in Washington, D.C. when we were on a trip at one time together, and it's just one of the I think all of them, but I was just trying to reach out, and she said, she's not, her response, I didn't talk to her directly. We could schedule a phone call, but she's not seeing people in person. So I was like, oh, okay. I don't know what that means yet, but it was just interesting. I was thinking I might be able to say hi or connect with a commissioner, and there wasn't a way to do that for that.
Yeah, interesting. That's all I have other than the Vets Village.
okay.
Commissioners, I sent you all, forwarded you a note this morning. Richard Coe would like to interview one of us to, in his words, understand the ballot measure for marijuana on in November. So he reached out yesterday. I told him that we wouldn't collectively be available to after the meeting. So after the meeting today, if one of you would like to be interviewed by him related to the measure, you're welcome to, or I can talk to him, whatever your preference is.
Okay.
So if you can let me know if
Who wants to talk? I'll talk to him. I don't know if whoever. Is it? I got to figure out what yes mean and what no means. I forget.
Yeah, he is basically all he said was that he wants to understand, what it does and, what the consequences would be based on a yes vote or a no vote. What are the implications?
Yeah.
So he just wants to make sure he understands. He also asked if there were any organizations that had been established to either support it or oppose it. And I said I wasn't aware of any, but that doesn't mean that there aren't any.
None that I know of.
Any other thoughts, or somebody else want to talk to them?
Well, if it's just understanding the measure, I mean, sometimes the press is talking to our legal when they should be talking to us, it seems like. But in this one, they should probably be talking to our legal, so I feel, because it's, but.
Well, and Tom's offering too, generally, I think, correct?
Yeah, I'd just give very black and white answers if you were to talk to me.
I mean, I think one question would be is, well, why is it on the ballot? You know, why was it put on? And it was, my thought was it was the frustration of, one hand, there was opposition to individual grows, but then there was opposition by the growers to the regulation. And so do we want more grows? Period, became the question, or does giving that vote to the people? But
Yes, it's pretty simple. And of course, it didn't make the state happy at all, even though they put in the original moratorium, which we matched.
yeah.
So we just wanted
I'll
to
talk to 'em.
make the moratorium permanent. You don't want to talk to them, right?
I don't know.
Well, think about it, because if you don't want to, I can. I mean, I know you didn't really, well, you did go along with.
Yes, because, no matter, for this, I absolutely support it, because no matter which way we go, we weren't getting this thing landed. So, yeah, we need more guidance from the voters at this point in time, because we were trying to update the regulations, as we said we would, a year later, and then that wasn't going to get landed either. So no matter which angle we went.
We're unhappy with the regulation changes, and
Okay, all right,
So Tony will.
I guess, yes.
Okay. And the only other thing, we do have a draft press release on the CARES Act designation if you want to see it, or you can do that after the executive session, up to you.
Okay, Whitney, do you want to show it to us now? That was incredibly quick of you.
She's
Incredibly efficient of you, I might add.
I will note there's placeholders for dollar amounts in here, so don't let that throw you.
Okay.
Very
Oh.
good spot check all the math.
We expanded it so it's not only restaurant, but it's pool and spa too, Whitney.
Okay.
Yeah, there's, we went down the list and, picked up a couple. Let's see. I know I have it here if you want those.
I think I can make that language.
Okay, all right, yeah, we wanted it to really be a bit more fair, because, pool owners, spa owners, everybody was shut down for quite a while, and then restaurants have been highly impacted. And it probably is better to say the dollar amount than 60% of their fees, don't you think?
I think that would give people a better sense of.
Right, that we are giving back a significant amount of money.
So for that introductory paragraph, maybe change the order around to the way we have the 3 paragraphs. So investing in families, business, and public health.
I would probably also suggest that we talk about the full 6.5 million as opposed to just the new 4.3, and say in addition to the 1.8 or 2 already.
And I might want to say.
Well, how about allocate the remaining 4.39?
Well, yeah, that's where you can have a little implied.
So instead of designating, we're allocating, and
Yep.
the remaining 4.3 And it seems like this.
Allocated for. Which.
Okay, and
read
this
into the.
state pass-through.
Yeah, something like that.
Yeah. Well, I think there should be something in this that most people don't know, that this is federal money stopped by the state and then given, you know, that it's pass-through money from the federal. I think there should be a sentence like that
From the
somewhere.
federal government, and we are still working on getting more of that funding?
Yeah, maybe, yeah.
From the
Right in the
state.
first part, CARES Act
Yeah.
federal dollars.
It seems that, right.
Okay,
So-
We're a couple million short.
That first sentence, CARES Act federal funding, continue investments in the things we're talking about, and then a secondary sentence that says this money came through the state to us. Is that what I'm hearing?
Or if you just call it federal money, that's good, because that's what seems to be lost by the state, is that it's not their money anyway. So I think we should add in the investments in local public health response, support for childcare and activities, local businesses and families, because the childcare is a big portion of it now. It's almost, well, it's over $1 million, so.
Got it.
Vulnerable populations.
So it's restaurant, hotel, pool, and spa, I think, something along those lines.
Okay. My plan was to send this through health services for some eyes on it as well, and that has not happened yet.
So really, it's two different things, support for local business and support for children. I mean, in my mind, I mean, the one, I mean, you could just add children in the header, but
Well,
like a lot of that Better Together money is not really business oriented at all.
I
It's,
think what we could do, and I kind of struggled with that, is flip the childcare support section up into that top header, which is support for children, families, and vulnerable populations. I kind of vacillated on whether to put it in that section because it's a clear fit up there, or whether to include it in business support because we do have a lot of.
I think it's better down there. It's because only a little bit of this is childcare businesses. Like the 650 is not businesses at all,
But
really.
it goes together with business, because if people don't have a place for their kids to go, they can't work.
And
So
I kind
it's,
of landed
it's,
it where I landed it, but I think either way is probably.
Oh, I see.
yeah, I mean, people can't work if they don't know their kids are, like in childcare or in.
But it's really for local employees. It's supporting the employees of those businesses that need to work too. I see what you're trying to say. I guess the fact that it didn't even register, that's what you're trying to say, is what makes me wonder if it's the right spot, because you're right. We're doing it but we're also doing it for children, so that children keep active for their own benefit. There's kind of the dual benefit.
Or if
Yes.
the board wanted to, I could just create a fourth category that's just childcare and just break it out, because it is a really significant portion of the funding, so I think it would definitely.
I'm good with that.
Right.
Yep. And then, yeah, make the support for
trying
local
to-
business section smaller. You
Yep.
can use less words there.
Okay.
I'm just looking at the proportion of the page. Yep.
But you do need to add a sentence in there somewhere that state funding has been, we haven't seen all the funding that the federal government originally had promised us. What did they short us? Like
Well-
400 million or something for the counties?
But the flip, I mean, somebody have to know more about that, because the state's purchasing PPE on our behalf and doing other things on our behalf, so.
They say they are.
But there's two sides to the argument, is my point, yeah.
That is.
Well, I think I'm okay if we just put the federal funding, the 4.39 of federal funding. It's a separate issue if we want to comment about how poorly this state government has done in giving us our money, which I'm inclined to do also. But maybe we just say federal allocate the form of remaining coronavirus, CARES Act federal funding to continue investments in public health, support child and local businesses and families. Do you have enough to do a second draft?
I do. Do we want to give feedback on quotes and who may want, so I can include that in that second draft, or would you like to handle that offline, or?
Well, I like the middle one.
You mean the one there's no doubt?
There's no doubt. I like that. I'll take that.
Okay, that was the best quote, I believe. So
Well, she asked, and I just.
I know, you said it first. I was just still thinking.
And we can massage these, obviously,
Mhm.
kind of personalize them as we want to.
I'm good with either of the other quotes,
Yes,
too.
so am I.
Okay, flip a coin.
We'll do that for the second draft, and maybe if the board, would you like for me to bring you back a V2 after your executive session? Do you want to take this up another day? I think we're late in the news cycle for today. But
Can't you just email us the copies and we'll look at it in the
Yeah.
morning maybe? And
Well, so yeah,
back to
That would
you?
be great.
to try to get it out tomorrow would be the goal.
We would love it if it
Yeah.
could go out tomorrow.
Yep,
sounds
great.
good. Thank you.
Thanks for doing it.
So when I drive in the morning, I can hear it on KBN.
Because it'll slip through the weekend, and it'll be a week from now.
Oh, and
for
it's
now.
a 3-day weekend.
Yeah, yeah,
So
that's
we
exactly
need it
why
out
tomorrow's
tomorrow.
important. Yep.
Okay, sounds
Yes.
good.
Thank you, Whitney. Thank you. This is lovely. Great work. Thanks for getting it done so quickly. All right. So may we go to executive now, or is there anything else we need? Okay. We now need to remove Wednesday on where we are and what we can do. And we definitely realize that there are lots of veterans that could fit into our population of 15 or less. So, thank you, Colleen. Thank you, Janice.
Thank you.
So
Have a
do we
great
have-
day.
Do we have anything else that we need for executive? Okay. Can we go back to regular session then, please, Stephanie? Thank you so much. All right. Thank you very much for joining us this afternoon. We are now going to adjourn our Board of County Commissioners meeting. Please remember, be safe, practice your social distancing, and have a wonderful weekend. Thank you.